Thank you, members. The next items of business are motions to approve 5 statutory rules, all of which relate to the health protection coronavirus regulations. There will be a single debate on all 5 motions. I will ask the Clerk to read the first motion, then call upon the Minister to move it. The Minister will then commence the debate on all of the motions listed on the order paper. When all who wish to speak have done so, I shall put the question on the first motion. The second motion will then be read into the record, and I will call upon the Minister to move it. The question will then be put on that motion. This process will be repeated for each of the remaining statutory rules. If that's clear, then we shall proceed on that basis. And I ask the Clerk to read the first motion, please.
That the Health Protection Coronavirus Restrictions No. 2, Amendment No. 13, Regulations Northern Ireland 2020 be approved.
Thank you. I call the Minister of Justice, Mrs Naomi Long, to move the motion.
I beg to move.
Thank you, Minister. The Business Committee has agreed that there should be no time limit on this debate, and I call upon the Minister of Justice to open the debate on the motions. Minister.
Thank you, Mr Principal Deputy Speaker. This morning I am asking the Assembly to confirm 5 sets of regulations now made. These Department of Health regulations introduce amendments to the Public Health Protection regulations, which are made and amended as necessary to give effect to the Executive's decisions. I have, however, agreed to lead the debate this morning in the Chamber for 2 reasons. Firstly, whilst all of the regulations are prepared by the Department of Health, in the case of the first 2 sets of amendments concerned with the increase of fines and penalties, my department worked in collaboration with Department of Health officials. Colleagues will recall the Executive's agreement to the proposals that I brought forward in October to increase fines and penalties and to introduce a number of new offences on foot of the rapid review of fines and penalties requested by the Strategic Compliance Group. That group was set up earlier this year by the Executive to oversee arrangements for encouraging compliance with public health restrictions. It was a natural step, therefore, given my department's role, for me to lead this debate. Secondly, as my officials were preparing for the debate, 3 more sets of amendments to give effect to the Executive's decisions with regard to public health restrictions were made. I therefore further agreed to lead the debate on these sets of amendments in the interest of supporting the Health Minister and the Executive Office in a collaborative way. Turning now to the regulations. The first of these, the Coronavirus Restrictions Amendment No. 13 regulations, deals with a number of changes to the main public health regulations, commonly referred to as the No. 2 regulations, in respect of the offences and penalties that apply when the restrictions are breached. The second set of regulations, the 4th amendment to the regulations dealing with the wearing of face coverings, increases the level of fixed penalties for failure to wear face coverings in settings prescribed by the coronavirus regulations. Both sets of regulations came into effect at 5:30 p.m. on the 12th of November. The third set of regulations, the Coronavirus Restrictions Amendment No. 14, provide district councils with the powers to enforce the No. 2 regulations, including the issue of premises improvement notices. These regulations came into effect at 4 p.m. on the 13th of November. The 4th set of regulations, the Coronavirus Restriction Amendment No. 15 regulations, deal with the extension of the restrictions initially introduced on the 16th of October and the limited relaxation of these restrictions in respect of coffee shops, close contact services and off sales. The regulations came into effect at 6:30 p.m. on the 13th of November. The 5th and final set of regulations, the Coronavirus Restrictions Amendment No. 16, ensured that unlicensed premises which reopened on the 20th of November were restricted to no more than 6 people per table from no more than 2 households. These regulations came into effect at 8 p.m. on the 19th of November. I will now set out in detail the content of each of the set of regulations in turn. SR 2020 number 250, the Health Protection Coronavirus Restrictions No. 2 Amendment No. 13 Regulations Northern Ireland 2020, were signed at 5:30 p.m. on the 12th of November and laid before the Assembly at 9:30 a.m. on the 13th of November. Amendment No. 13 increases the previous fines and penalties and introduces new offences as follows. The fixed penalty, which previously started at £60, has been replaced by a single fixed penalty of £200 or if paid within a period of 14 days of issue, £100. This penalty applies to breaches of restrictions relating to gatherings in public or private places, which remain punishable on conviction by a fine of up to £5,000. The regulations also provide that the recipient of a £200 fixed penalty cannot be issued with another one in respect of the same offence. The option of summary prosecution may be used instead. The offences of not closing a business as required or breaching the early closing requirements for hospitality will be punishable on conviction by a fine of up to £10,000 or attract a fixed penalty starting at £1,000, which can be increased for subsequent breaches up to a maximum of £10,000. A new offence of not implementing measures to maintain social distancing in retail and hospitality settings will be punishable on conviction by a fine of up to £10,000 or a fixed penalty starting at £1,000, which can be increased for subsequent breaches up to a maximum of £10,000. And a new offence of organising or participating in a large gathering or unlicensed music event, with large defined as 30 persons or more, will carry the new higher level penalty for organisers, that is, punishable on conviction by a fine of up to £10,000 or a fixed penalty starting at £1,000 and increasing up to a maximum of £10,000 for further breaches, and the new lower penalty for participants, punishable on conviction by a fine of up to £5,000 or a fixed penalty of £200. The fixed penalty of £200 will reduce to £100 if paid within 14 days of issue. Next are SR 2020 number 253, the Health Protection Coronavirus Wearing of Face Coverings Amendment number 4, Regulations Northern Ireland 2020, and were signed at 5:30 p.m. on the 12th of November and led before the Assembly at 9 a.m. on the 13th of November, and increase the penalties for failing to comply with the health protection regulations in respect of the wearing of face coverings as follows. The fixed penalty, which previously started at £60, has been replaced by a fixed penalty of £200, or if paid within 14 days, will be reduced to £100. This penalty, which remains punishable on conviction by a fine of up to £5,000, applies to breaches of restrictions relating to the wearing of face coverings in settings prescribed by the regulations. As before, the regulations also provide that the recipient of a £200 fixed penalty cannot be issued with another one in respect of the same offence. Moving on then to SR 2020 number 255, the Health Protection Coronavirus Restrictions number 2, Amendment number 14 Regulations Northern Ireland 2020. Those were signed at 4 p.m. on the 13th of November 2020 and laid in the Assembly at 5 p.m. on the 13th of November 2020. These regulations provide district councils with the power to designate persons to enforce the number 2 regulations and to issue a premises improvement notice where those responsible for premises are in breach of the number 2 regulations, and to specify a time limit within which the measures required must be taken, which must not be less than 48 hours from the time the issuing of the notice. SR 2020 number 256, the Health Protection Coronavirus Restrictions number 2, Amendment number 15 Regulations Northern Ireland 2020, were signed by the Department of Health at 6:30 p.m. on the 13th of November and laid before the Assembly at 9 a.m. on the 16th of November. These regulations deal with the extension of the restrictions initially introduced on the 16th of October and the limited relaxation of these restrictions in respect of coffee shops, close contact services and off sales. These regulations allowed the reopening under certain conditions of unlicensed food and drink businesses, cafes and coffee shops mostly. They were allowed to reopen from the 20th of November with opening hours limited from 5 a.m. to 8 p.m. The reopening from the 20th of November of close contact services sector, including hairdressing, tattoo parlours and holistic therapies and driving instruction. As a condition of that reopening, these businesses were required to operate only by appointment and were required to collect and retain for a period of time the names and contact telephone numbers of customers for contact tracing purposes. And finally, the regulations removed a restriction that had previously been placed on pubs and bars that prevented them from selling alcohol for consumption off the premises. Although many bars and pubs have an off licence, the regulations had sought to prevent them selling alcohol for consumption off the premises during this time. The lifting of this restriction was accompanied by the requirement that they only sold drink in the original sealed container so that bars were not selling glasses of alcohol to customers on the street. Then SR 2020 number 276, the Health Protection Coronavirus Restrictions number 2 Amendment number 16, Regulations Northern Ireland 2020, were signed at 8 p.m. on the 19th of November and laid in the Assembly at 9 a.m. on the 20th of November 2020. These regulations ensure that the unlicensed premises which reopened on the 20th of November were governed by a rule to restrict numbers of customers to no more than 6 per table from no more than 2 households. These 5 sets of amendments are designed to encourage adherence to the restrictions and to deter any breach of them. They complement the basic but critically important and consistent public health messaging of wash your hands, keep your distance, wear a face covering. I beg to move.
Thank you, Minister. I call the Chair of the Justice Committee, Mr Paul Given.
Thank you, Mr Principal Deputy Speaker, and I'm pleased to be able to speak on behalf of the Committee for Justice in this debate today. The Committee for Justice first received notification of the health protection regulations before the House today in a written briefing from the Department of Justice that was received on the 1st of December. Yes, that's 7 days ago, 1 week ago, was when the Committee was provided a written briefing. The Committee was advised that 2 of the regulations are of relevance to the Department of Justice as they relate to offences, fines and penalties for breaches of the regulations. Therefore, although the responsibility for the regulations rests with the Health Minister, the Minister of Justice agreed to lead the debate on those 2 regulations along with the 3 others in support of the Health Minister, as the Justice Minister has outlined. In the course of this pandemic, the Justice Committee has received both written and oral briefings and updates on COVID-19 and the impact on the justice sector on a fairly regular basis. We have questioned officials and senior police officers, including the Chief Constable, on breaches of the regulations and the approach to enforcement. We have sought information on the number of fines and fixed penalty notices issued and also on the number and type of breaches that have been reported via the COVID-19 hotline. Despite this, there was no engagement by the Department with the Committee on the review of fines and penalties that gave rise to the challenges reflected in these regulations. The review of offences and penalties was carried out collaboratively by the Department of Justice and the Department of Health, and it was the Minister of Justice who recommended the proposed changes to the Executive. The Department of Justice advised the Committee that those proposals were considered by the Executive on the 8th and the 15th of October. There was therefore, Mr Principal Deputy Speaker, ample time to inform the Committee for Justice of these proposed changes well before the notification of the 1st of December. It has been said...
Ms Bradshaw, point of order.
Okay, Principal Deputy Speaker, would you remind the House that section of Standing Order 43.1 provides that the statutory rules laid before the Assembly and subject to Assembly proceedings, including negative, affirmative, confirmatory procedure, shall stand referred to the appropriate committee for scrutiny. And in this instance, because they are Department of Health regulations, that it is right and proper that we as a committee were the ones that scrutinised it. Thank you.
The member's understanding of Standing Order 43.1 is correct. Mr Given.
Thank you, Principal Deputy Speaker. It has been said many times before that this situation is unprecedented and it is sometimes necessary to make changes at a swift pace. However, that does not appear to have been the case in this specific instance. The Committee discussed the Department of Justice's written briefing on these regulations at the meeting on the 3rd of December. The Committee recognises that the scrutiny of the health protection statutory rules is a matter for the Committee for Health, and that the Committee is often required to consider regulations at short notice, which does not always allow for consultation with other committees. The Committee is concerned, however, that there may be a more widespread scrutiny deficit, with statutory committees being either unaware or provided with last-minute notification of policy changes relevant to their department's remit that are being included in health protection regulations. I will therefore be writing to the First and Deputy First Ministers on behalf of the Committee to ask all the departments to engage with their respective statutory committee on matters to be included in the health protection regulations that fall within their remit at the earliest opportunity. I am unable to provide the committee's position on the regulations, given that we have not had the opportunity to consider them or the policy intention behind them. I understand that the Department of Justice officials gave oral evidence to the Committee for Health, and therefore it will be for the Chair of the Health Committee and members of the Health Committee to comment on the specific aspects in respect of the detail contained within the regulations. Mr. Speaker, those remarks are made in my capacity as Chairman of the Justice Committee. I appreciate some members seem to struggle to recognise the role of a Chairman of a committee, but that position is the unanimous position held of all of the parties within the Justice Committee in terms of what I have just articulated. Setting aside my role as Chairman of the committee, speaking as a personal capacity in respect of these regulations and the process by which they have been brought about, the Justice Committee recognises, as I outlined in my role as Chairman of the committee, the unprecedented way in which these regulations have been taken forward. It recognises, and I recognise, that it is the legislative framework through the Department of Health and indeed then the Statutory Committee for Health to deal with the detail around the statutory rules. And indeed I received a letter from the First and Deputy First Minister yesterday outlining this issue, and I want to thank and put on the record my appreciation to Arlene Foster and Michelle O'Neill for writing to me in my capacity as Chairman of the Justice Committee. And the First and Deputy First Minister outline the approach that the Executive have been taking, the collaborative way in which they are seeking to operate, and I agree with all of that. That is not, however, withstanding the issue around the roles of committees. And in my conversation that I had with the First Minister yesterday, I was able to provide that assurance to the First Minister that the Justice Committee takes its role very important, as do I in terms of my membership of that committee. And where committees have an opportunity to engage and to be consulted upon, that is something that I would advocate that all ministers should be doing with their relevant committee. Because under the relevant powers conferred upon committees within Section 29 of the Northern Ireland Act 1998, and indeed standing orders of this House, Standing Order number 48, Mr. Principal Deputy Speaker, it outlines the powers of committees. And within the powers of committees, the final bullet point says that for the Justice Committee, it is to consider and advise on matters brought to the committee by the Minister for Justice. We were denied that opportunity because the Minister for Justice did not come to the Justice Committee. Departmental officials did not come to the Justice Committee. We recognise the legal statutory process for how this is being engaged, but whenever it came to what the Minister could have done, she could have led the way on this and engaged with the Justice Committee. She chose not to do so. That's a decision for the Justice Minister. I'll take an intervention, yes.
What happens in the Alliance Party is that if an issue comes before us as a Health Committee that crosses into other departments, I engage with my MLA colleagues in those departments or those committees to find out their position on it. I engage with them before I go so that I am there representing the whole party at the Health Committee. Are you suggesting that that is not what has happened in your side of the House?
Well, of course my members will engage across political parties, but that is not to negate the opportunity that all members of this House have through our membership of the relevant committees to provide an opportunity. As I indicated, the committee has engaged with the Chief Constable. We have engaged with ACC Todd in terms of Gold Command when it comes to enforcement, and these are all relevant to the regulations when it comes to enforcement. So of course I understand the way in which things operate, but there are opportunities and members can bring that expertise through their normal committee membership. And what I think will be important to address, because in the letter that I received, which was circulated to all Justice Committee members, the Executive Office indicates that we understand that some members of the Justice Committee consider that in light of the Minister of Justice's offer to lead on tomorrow's debate, the scrutiny role should therefore have been conferred on it, and they intend to express their dissatisfaction during the debate. Now, I was able to provide useful information to the First Minister to explain what the Justice Committee had actually agreed to do. So I think there is an issue about what was the information source when it came to advising the Executive Office. Who provided the information on what the Justice Committee had agreed, what we had discussed? because it certainly has informed the basis of a letter that I would question. And I think there needs to be an explanation in respect of that, and no doubt the Minister will elaborate on it. But I will happily give way, despite the fact that the Minister never engaged with the committee. I'll, however, engage with the Minister on the floor of the Assembly.
Is the committee chair aware that the sessions of committee are public and that people can watch them on television?
Well, that'll be an interesting explanation if that is the basis upon which I received then this letter. Because if anyone watched the proceedings of the committee, they would know what the committee decided. Just for members' benefit, because the minutes of that committee meeting has now been published. So members will now know what the committee agreed. The committee agreed unanimously of all parties. At the meeting on the 3rd of September, the committee has agreed to write to FMDFM, asking that all ministers engage with their respective statutory committees on relevant aspects of COVID-19 health regulations that cover policy areas that are the responsibility of their departments. That correspondence is going to be copied to all chairmen, madam chairs of the different committees. The committee also agreed to ask the Department of Justice why there was no engagement with it or information provided on the review of offences or penalties and the proposed changes prior to the 1st of December, given that this falls within the remit of the Department of Justice. The committee also agreed to ask for the protocol advising the committee when DOJ officials are providing oral evidence to another statutory committee. At no stage did the Justice Committee seek to usurp the legal responsibility of the Health Committee in carrying out its role when it came to the statutory rule. However, there is nothing stopping, and indeed I would encourage the Justice Minister, as she seeks to work with the Justice Committee. We have an important role. We can provide you with advice and support, and we can give an insight. But, Minister, we can only do that when you decide to engage with the Justice Committee, and I hope that in future you seek to take a more constructive approach when it comes to these COVID-19 regulations.
I'm sorry to interrupt the member, but could I remind him that comments should be directed through the chair?
Of course, Principal Deputy Speaker. So turning to the specific regulations that relate to enforcement, and this is an issue that we have had to consider in the Justice Committee, and we have had the police in before us, because whenever you introduce, Principal Deputy Speaker, enforcement measures, the fines that are being introduced or that have already taken effect, what is vitally important is that we see a consistency of approach then in their application. We know from the early months that it took the police a period of time to quality assure, if I can put it in that way, the way in which they were dealing with checking people's activities, and we had those cases where the police were looking into people's shopping bags and wanting to know was that an essential item that was being bought, and we know the furore that that created. So the police had to put measures in place to ensure that there was a consistency of approach being applied, and I welcomed the way in which the police put those measures in place. Of course, we would have, had we been given an opportunity, we would have considered the proportionality of the fines being associated with it. Obviously, the Justice Committee, we would look at issues around fines for speeding offences, for example. We all know that speeding kills, and we would have been able to look at what is the current fine when it comes to speeding and compared it to this fine that has been introduced. However, we weren't able to do that because we weren't engaged. And then we need to consider how different breaches have been handled by the police service. I know members have raised the issue of policing protests, the Black Lives Matter protests that took place where fines were issued. Indeed, in the most recent regulations that have been introduced, we now have cases where church authorities have been interviewed by the police because of alleged breaches of those regulations. And then, of course, people compare and contrast that to the lack of police interviews when it comes to a particular funeral in West Belfast. And then we raise the issue about the public having confidence in the administration of these fines that are being put in place. So I would say, Principal Deputy Speaker, that in having enforcement measures, we then need to see them being equally applied to everybody in society. There cannot be a two-tier approach to policing. And the Minister for Justice has a particular role in ensuring public confidence in the administration of justice, and I know she will say these are operational matters for the PSNI, and that is a position that she has taken from assuming office. But whenever that operational decision-making process then impinges upon public confidence, I do think then that engages the scope of the Justice Minister. I'll give way to Mr Wells.
Let me give way that there's deep concern within the community that the police, we understand, have indicated that they're going to be swift to take action against Tandragee Baptist Church for its alleged breach of the coronavirus restrictions, whilst we understand that the police have yet to interview the leader of the party opposite in Northern Ireland, Michelle O'Neill, about what occurred and the disgraceful scenes we witnessed at the Bobby Story funeral.
Well, the member makes the point very well, and that is, whenever I look at these regulations that are going through the House today, we are increasing the level of fines, and we are making it clear as an Assembly that an enforcement is an important tool. It is the application then of that tool that requires consistency of approach by the Police Service of Northern Ireland. So I share the concerns that the member has elaborated upon. And so, Principal Deputy Speaker, it is important that effective enforcement measures are in place. But, Principal Deputy Speaker, we all have the power in our own hands to act in a way which is responsible, to apply common sense, that we shouldn't need enforcement within our community when it comes to policing these regulations. The best form of policing any society is self-policing. It is self-regulation. It is that awareness of one's own personal responsibility, and that's ultimately where we need to get to. However, there will always be a minority that flagrantly breach the law, and that then undermines the entire message, and that requires effective enforcement and policing to take place. In the absence of that, it then leads to people no longer acting in a way which I believe is necessary to be responsible. And what is the further consequence of that? The executive having to take action to close down businesses, those small businesses, close contact services, the hairdressers, the salons, and they have paid the price because there hasn't been self-regulation, and then there hasn't been the kind of enforcement that there should have been. And so let there be a better approach so that we don't need to take actions against those other individuals in our society and organisations. I'll give way, yes.
I appreciate the strength in which the member delivers the importance of ensuring we adhere to the regulations. Has the member given such advice to his colleague, Sammy Wilson?
Of course, all members need to behave in a sensible and responsible manner. That's for everybody in this House to conduct themselves in that way, in whatever parliament that you're in. But let's not get distracted by the core substance of what it is that we're dealing with today. It is important that we have a consistency of approach when it comes to the policing of this, and I look forward to hearing the Minister's response and providing a justification of her failure to engage with members of the Justice Committee. Thank you, Principal Deputy Speaker.
Thank you. I call the Chair of the Health Committee, Mr Colm Gildernew.
And appreciate the Minister being here today to address the Assembly in relation to these measures. The Health Committee considered the first 4 sets of regulations on the 26th of November, but Amendment 16 was included on the final order paper without prior notice to the Committee and therefore added late to our agenda on Thursday. Briefing on the first SRs, the first 4 SRs, was provided by a cross-departmental group of officials who gave an overview of the main provisions, including the extension of the Schedule 2 restrictions, subject to modifications, additional requirements in relation to premises selling food or drink, new premises improvement notices, and changes to penalties, including for failure to wear a face covering. Officials also advised us of a strategic level working group established by the Executive to look at compliance with coronavirus regulations. We were advised this is chaired by junior ministers and that it brings together a range of agencies and has conducted a rapid review since September due to concerns about rates of transmission and a desire to ensure effective deterrence from breaching the rules. Provisions relating to increased penalties prompted questions around rationale, necessity, the evidence base and equality considerations. The remaining questions centred on practical outworkings. Given the absence of a formal equality impact assessment of the higher penalties, members probed the consideration given to this matter, such as affordability issues relating to masks and the differential impact increased fines could have. While assuring the committee that such matters were taken into account and agreeing that there could be potential inequalities, officials couldn't provide detail and advised they might not be able to come back to us as the executive papers are confidential. Yes?
Thank the member for taking an intervention. Would the member agree with me that it's important that the PSNI continue their course of action around engagement, encouragement and enforcement, the 3 E's as they had talked about at the start, to address exactly the issues that you've just raised, to establish, in some circumstances people will just not understand the regulations. We have to accept that because they're very complex, even for those of us who are going through them every day. So for the ordinary people out there in the street, it is difficult, and I think the PSNI need to continue in that vein so that people fully understand the implications of what they're doing.
Yes, and thank the member for her intervention. Yes, I would agree. I think it is absolutely essential that this starts out from a point of view of, first of all, communication, but then certainly in terms of engagement and encouragement. And I think in some ways, when we come to enforcement, actually, it kind of demonstrates a failure of all those other steps, and that we need to very much work from that basis and to very much understand that there are people who potentially will struggle to abide by the restrictions due to lack of income, and they are difficult in some senses. So officials also outlined the continued approach to using enforcement as a last resort, in keeping with the member's intervention, but couldn't provide detail on trends or fines related to that. We wanted to know about the evidence base underpinning the increase in fines in terms of anticipated improvements in compliance, and officials said that they will come back to us on this. We asked about affordability issues in relation to masks, and we were advised that officials would take this back. Yes, I'll give way.
I appreciate the member giving way, and he is firmly on the record, as am I, in the inappropriate way in which these regulations come before the House and the lack of scrutiny thereof. The very points that the member has just outlined surely goes to the very heart of the lack of democratic scrutiny within this House. The very fact that we are here today debating these regulations when officials come before the committee and cannot provide the information, promised to come back and still haven't provided. Does he not agree with me that the very fact that the Justice Committee have outlined today that they had no role in the scrutiny of these regulations is some concern, given the lack of democratic scrutiny that has come before this House?
Thank the member for his intervention. I have been consistent that we need to see good information and good engagement coming across whatever committees are relevant to the scrutiny of these. I think the pertinent thing is that while we recognise that these are unusual situations, unusual circumstances, and I will later deal with the fact that we would not in normal circumstances be considering legislation in this way or changes to rules in this way. However, I think it is incumbent on all the departments and everyone concerned to provide that level of data and analysis. If committees, as the member has indicated, are being asked to support regulations, it should be provided with a clear sense of why that legislation is needed and why this particular approach is best versus another approach, and that we would be able to assess that. I'm quite sure these questions are asked. Yes, I will.
In the same vein, the Members' Committee has considered a successive number of these regulations. Each one of them, on the face of the regulations, bears the affirmation that there was no impact assessment, sometimes no regulatory impact assessment, or simply no impact assessment. Has that never given the committee any concern that you're asked to consider regulations where there's been no impact assessment?
Thank the member for his intervention. Yes, that is one of the issues of concern and one of the issues that the committee are increasingly seeking to ensure that whatever vehicle is used, that there is a maximum consideration given. But as we move further into what should be normal ways of operating, I believe that there should be equality impact, or there should be some attempt made to address the lack of equality impact. So On a practical note, the detail of information to be gathered by hospitality settings was raised. A member suggested that the requesting an address might support businesses wishing to comply with the rule restricting numbers of persons at a table to no more than 6 and from no more than 2 households. And so responding to a question on the distinction, and I recognise that is difficult. Actually, I've spoke this morning with someone who's involved in the hospitality business who reports that that is a very difficult thing to establish. Responding to a question on the distinction between retail and office settings, officials explained that health and safety legislation deals with workers, whereas the present suite of regulations is aimed at protecting the public. The committee is, as ever, seeking to be constructive, but also to provide the appropriate scrutiny on behalf of the public. And one source of data that does inform the committee on a regular basis, along with all of the other pieces of information, is, unfortunately, the new daily case rate, the hospital admissions, the ICU capacity, which is today sitting at 99%, and, sadly, the daily reported deaths, which as of today are 1,059, and none of that evidence and information can be ignored either. Despite reservations arising from some unanswered questions, the committee agreed to lend its support. The committee recognises that the regulations are cross-departmental in origin, and the committee has written to the Health Department as the drafting lead, seeking to have its concerns heard and addressed in future sets of regulations. Indeed, something the Justice Minister could directly comment on in her response is whether the Department has been consulted on directly at this time in developing a new COVID-19 strategy, or even if the Executive has seen a new detailed strategy that includes pillars of finding, testing, tracing, isolating and supporting the public. This was a Health Committee motion agreed by consensus in the committee and again agreed by consensus here in this House. We have called for a new COVID strategy developed by the Department of Health and supported by the wider Executive to end a cycle of lockdowns. That was passed last month in this chamber, and as we enter the early phases of Christmas and the vaccination programme, it would be timely to hear in progress to date on any development of that new robust strategy. So, with your permission, I'd now like to address members briefly in my role as MLA and Sinn Féin spokesperson for health. I'm sure many members will make similar points as the debate goes on, but I am concerned about the steady number of new cases announced daily. To put it bluntly, we're not seeing the drop in case numbers, in admissions and sadly in deaths that we had hoped for. I cannot help but think of the absolute mess when public health proposals were voted against in the Executive using a cross-community vote, and where we could be now, or maybe now, if the Executive had been able to act quicker. However, we are where we are.
I note what the member has said in relation to where we are today, but had the member the same concerns when most of his colleagues on the benches around him actually attended a funeral in breach of the same regulations?
And that matter has been addressed multiple times in this Assembly. However, we are where we are, and one constant feature during the COVID-19 pandemic has been the ever-present lack of time. So I think it is to be expected that some of the technical amendments that tidy up the original intentions of the decisions are brought forward. It has to be said again, none of us want the restrictions to be in place for any longer than they have to be. However, unfortunately, the case for restrictions are being made often better in the corridors of the ICU wards, on the countless calendars of missed crucial appointments for other health matters, and on the need for family to resort to FaceTime calls visiting family members as a result of home visiting restrictions. I support these amendments, and let's continue to do all we can individually and collectively to help stop the spread of COVID-19.
Thank you. I call the Chair of the Executive Office Committee, Mr Colin McGrath.
Thank you very much, Mr Principal Deputy Speaker, and I'll be making my remarks as an SDLP member. I want to thank you for getting the opportunity to be able to speak in this debate today, and I thank the Justice Minister for coming to the House today and actually bringing some legislation forward and participating in the debate. Mr Speaker, the regulations which we are being asked to debate and ratify today do take us back somewhat to about the middle of November. and that is a time which, on reflection, many in this House would choose to forget, given the chaos that was allowed to take hold at that stage. But today is a momentous day in terms of the fight against COVID-19, and we must keep our eyes fixed firmly on the future and how we will do things from here. And I think it's important that we note that the first COVID vaccine has been given to Margaret Keenan over in England, although hailing from Enniskillen, and the first vaccine has been given here in the north to a constituent from South Down, to Joanna Sloan, who is a nurse, and we welcome that she has received that and wish her and everybody else that receives that vaccine the very best as they move forward to deliver the vaccine to people right across Northern Ireland. To the amendments themselves, Mr Principal Deputy Speaker, amendments number 13 provide additional requirements in relation to food and drink establishments, further provision for social distancing and large gatherings, and increase the fines that a breach of these carried. Amendment number 4 for the face coverings also increased the level of fines on those who breach the regulations. Amendment number 14 gives district councils the power to attach premise improvement notices to businesses who needed to amend their protection in light of the regulations. And then Amendment 15 concerned the circuit breaker that allowed the phased reopening for close contact services and the gradual reopening of hospitality. Finally, Amendment number 16 concerns those in close contact services working in film and television production and the number of households at a table in hospitality. I don't know about anybody else in here, but getting the timeline of events that happened back then and mapping them out can be quite confusing. There are so many different amendments that are being updated. Some of those amendments lapse by the time that we have the conversations here in the House. Some of the amendments have since changed, even though we're discussing them in the House. And I'm sure that everybody here in the House today can resonate with getting asked a question, be it from a constituent or constituency office staff, that requires you to stop and think back in your head to work out exactly what the regulation is and what the impact of it is. But let's not be under any illusions. This role of scrutiny and legislating is definitely not for the weak of heart. But what I do know, however, is that these regulations were and are necessary. We needed to do and need to continue to do all that we can to stop the spread of the virus and to help our beloved healthcare staff, who frankly have been the absolute heroes in this. We need this more now than ever as this vaccine is rolled out. But how do we actually do some of that? Well, we have to normalise some behaviours that previously would have seemed improbable or potentially even impossible. For example, the wearing of face masks has become, for most of us, normalised. When someone in the public is not wearing a face mask and they are coughing or sneezing, you become very aware of the fact that they are not wearing a face mask. And how do you encourage the wearing of face masks? Well, you can do it through the science, and you detail the reasons for actually doing it. You can do it through encouragement and asking people to carry out the activity of wearing a face mask. Or, if necessary, from time to time, if people refuse, you have to levy fines. But that is what gets the conformity from around about April, May time through to now. So very quickly in wearing face masks has been all of those together, but fines have played their part. Yes, of course.
Would it not also be an encouragement for some people to wear masks if they were made freely available? I mean, these masks aren't inexpensive sometimes, especially the disposable ones, and if they were made freely available, you might see more people more likely to wear them.
I thank the member for his intervention and know of his continued intervention in the Health Committee, especially highlighting in South East Asia, where face masks are worn regularly, and they have been part of the ability to control the spread of the virus there. And yes, I totally agree with him. I think they aren't very expensive I think from checking DUP returns are about 48 quid for quite a considerable box load of them for people. And I think if you can actually get the face masks and make them available for people, then it would encourage the use of them. And I know it is an extra cost for businesses, but I think sometimes people do find themselves at shops and other places and in a situation where they don't have a mask and they could do with one. So I think just having the general availability of them would certainly help. Sorry, going ahead.
I appreciate the member giving way, and he's articulated a clear position around the need for wearing masks, and one that I wouldn't disagree with. Would he also comment for those who, under the law, rightly have an exemption for respiratory reasons, whether that's asthma or indeed psychological reasons? And it's important that we respect their position and that we don't have a scenario where people are being shamed because they have legitimate health reasons not to be wearing a face mask.
I thank the member for his intervention and believe that those protections are in legislation and in the regulations as well, which actually specifically highlights that those that have particular reasons for not wearing masks shouldn't have to wear them. So I welcome that those protections are there as well. Members, yeah.
I thank the member for taking a second intervention in such a short space of time. Just in light of what you have said around that provision and people finding themselves at shops, and I have seen that even for myself on many occasions, it is an issue. And if you've come by public transport, it's different if you only have to go back to your car. But if you've come by public transport, some shops do provide them, and I would encourage, I mean, these are the shops, these are the retailers in most cases that have been able to stay open right through the pandemic and have done fairly well because they've been able to stay open. I think that they would be in a good position. We're talking about the big, large retailers will be in a position to provide free masks.
I thank the member for the intervention, and again I think just holistically we are making the point that if we can make masks available, it's of benefit and it is something that we should continue to do, and I would welcome that. In terms of the overall regulations that we're looking at today and questioning whether they were necessary, I think we have all accepted that the regulations that we currently have were and are necessary, and it does make you beg the question of asking, why did we stop for a week in the middle of the circuit breaker, reopen everything, and then close it back down again for a further 2 weeks? It does feel like that just didn't sit right. It means that we'll see a slight rise in cases, then we've shut down for 2 weeks, and then things go back down again. And one has to reflect back to that period of time and say, would it have not have been better to have gone the 6 weeks right through? And I think it's already been mentioned that the numbers aren't dropping as we would like to have seen them, and I hope that may have been because of that week where we didn't shut down. Yes, give way.
For being so generous in giving way. Will the member agree with me that intervention is absolutely essential to help support businesses through this very difficult time? However, the Eat Out to Help Out scheme may have been too generous and far too early in that intervention, given that it absolutely has fed into the level of infection in our communities.
Yeah, I mean, I thank the member for his intervention and think that, yes, we do need to provide as much support as we can to businesses because they are having a difficult time, but at the same time, we do need to make sure that the protections and support that we're providing for businesses maybe doesn't have an inadvertent consequence, but I hope that we can provide the financial support that businesses do actually need, and that way mean that they do not need to operate to a level that may cause some difficulties. But, Mr Principal Deputy Speaker, the vaccines are being rolled out to the most vulnerable and those at risk. Christmas is ahead of us. There's very real hope going forward into the new year, but our work as legislators must continue. In conclusion, as we come to the end of the year once again and prepare to begin anew, let the lessons of the last few weeks not be lost on anyone in this House. Bullheadedness and digging your heels in gets us nowhere. It will only set us back. Let's approach the new year with a sense of optimism of what has been done, where we will have let the public down, and a renewed sense of clarity, collective purpose and cohesion for the Executive. Therefore, Mr Principal Deputy Speaker, while I have issues with what's happened and in the way that it's happened in November, we continue to be looking forward to the future, and we support the amendments as they're presented today. Thank you.
Thank you, members. Given that it is now 12:51 and the Business Committee is due to meet at 1 o'clock, I propose, by leave of the Assembly, to suspend this sitting until 2 p.m. First item of business when we return will be questions to the Economy Minister. When this item of business resumes, the next speaker will be Mr Doug Beattie. Thank you, members. The sitting is suspended.
This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Signed. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary Programme Sound. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland Assembly Plenary. Programme signed. This is the Northern Ireland.
Order members, the sitting is resumed, and it's now time for questions to the Minister for the Economy. Can I advise members that question number 10 has been withdrawn? I now call Declan McAleer.
Ceist over hand, question 1.
Mr Deputy Speaker, with your permission, I would wish to group questions number 1, 2 and 4. And again, with your permission, Mr Deputy Speaker, I'd like to avail of the extra minute to answer this grouping. I am delighted that Project Stratum, delivered through the DUP Confidence and Supply deal, is now up and running. Project Stratum will utilise public funding together with fibrous networks investment to deliver gigabit-capable broadband infrastructure to more than 76,000 primarily rural premises across Northern Ireland. The citizens and businesses in these areas have waited far too long for acceptable broadband, and their struggles have been deepened by the COVID-19 crisis. As some 97% of these premises are classed as NISRA Band H, which is settlements of less than 1,000 and open countryside, the entire intervention area is a priority for my department. Deployment work is already underway. That is very significant, as within the 9-month period initially thought to be required for network design, some 19,000 premises will have been passed. I appreciate that members want to know how Project Stratum will impact on their areas. My department is engaging with fibrous networks to ensure that citizens and businesses can access further information regarding deployment plans and project implementation dates. An online portal has been developed by fibrous networks to provide this key information throughout the deployment phase of the project. Details of the deployment plan are now available on the portal, and a premises checker will be added over the coming weeks. Links to the Hyperfast NI portal can be found on both my department's and Fibrous' website. The portal will be updated and expanded as the project progresses. I understand that members may feel disappointed that their areas are further into the rollout cycle than maybe they would have preferred, but I would ask for patience in this regard. It is vital that the network is designed with technical and economic efficiency. That will enable as many premises as possible to benefit from the intervention. I hope that members will agree that the important message for citizens and businesses is that a solution is now in reach, and all those premises that were struggling to reach acceptable broadband will be served with this intervention, making them among the best served places for broadband in the United Kingdom and indeed throughout Europe. I can also assure members that the management structure for Project Stratum contains the required tiers of project oversight to support robust governance procedures. These include a project board and project management team. The project board will monitor progress.
The Minister's 3 minutes is up some time ago.
Sorry, it's a lot of information to be got out.
I call Declan McAleer for supplementary.
I thank the Minister for a very comprehensive response. And like many other MLAs, particularly those represent rural areas like I do in West Tyrone, which is in the Springs, we're all itching to know when it's going to come to our local town or village. But I suppose the question I want to ask the Minister was that whenever the project Stratum was conceived at the outset, it was estimated that the number of premises that hadn't got access to super-fast broadband was over 100,000, whereas Project Stratum now targets 76,000. So I just want the Minister to explain that gap, and if indeed there is a solution for those, what it looks like 30,000 premises that aren't currently part of the Project Stratum intervention area. Thank you.
Can I thank the member for his question? I do apologise, Mr. Speaker, but this is an area that I know that my department is receiving a lot of questions about, and that we would want to have a fulsome response for the members in the chamber. The identification of the projects came about through an open market review. And that identified the potential number of premises that were available. Those then were looked at in conjunction with the already existing commercial access to broadband, and that gave us the number that we are looking at within the Project Stratum intervention area. There are about 3% of other premises that we would like within that intervention area, and we are currently working with our national government to try to work out a solution for those premises, and will come back to the House as quickly as possible within that. I know that the member will be interested in this, but in West Tyrone, 9,591 premises will avail of superfast broadband due to Project Stratum.
I call Keith Buchanan.
Thank you, the Minister, so far for your answer. I first of all like to welcome the Minister for work in getting this rolled out. And indeed, We're now seeing confidence and supply money rolling into Northern Ireland, and we'll see now supply and confidence in our broadband. To all communities, I made add, all communities. Some at the very start was very negative in their comments toward this, but this is going to be across all communities and support all of them. There's 18 constituencies in Northern Ireland, but obviously there's only one minister, the most important one, with Ulster. What's that going to do? What's that going to do for the average homeowner, pupil, student in Mid-Ulster?
Thank the member for his question. In Mid-Ulster, again, and I looked these up on the portal before coming here, 8,785 premises in Mid-Ulster will benefit from next generation broadband thanks to the Project Stratum intervention. We've all seen how families have struggled with homeschooling, with homeworking during this pandemic. That will increase their ability to do these kind of things no end. It also, very importantly for the economy, and one of the key aspects of our economic goals is to have a regionally balanced economy. And also the new connectivity for the economy is fibre, and that will help us to get a regionally balanced economy so that rural areas where they might have been served with very poor broadband can now be connected and work in the same way as more urban settlements.
I call John Blair.
Speaker, thank you, and could I also thank the Minister for the answers thus far. In addition to those, can I ask what work is taking place by the Department with groups such as the Community Fibre Partnership to ensure that those areas not yet included and those that are harder to reach, and I have some of these in my constituency, I'm sure the Minister will have some in hers, that those areas can be included in this or future programmes?
Well, as I have said to the Chamber in response to my other colleagues, there are a small number of premises that are still within that very hard-to-reach category that are outside the scope of the current Project Stratum, and we are in discussions with the Department for Digital Culture, Media and Sport and with Fibrous Networks as to how we can bring solutions to those premises. That will most probably be on a cost and a case-by-case basis, but we are determined to try to have the best broadband services in the whole of the United Kingdom, if not Europe, for Northern Ireland. That's an enormous selling point when we go to talk to investors across the globe.
I call Sinead McLaughlin.
Speaker, and thank you, Minister, for your answers so far. Project Stratum is indeed a very welcome initiative, and it couldn't come sooner. I'm just asking the Minister, really, what review mechanisms has she got in place? For example, if the project is delayed or if the rollout isn't just up to the standard or the expectations that her department has?
I'm not anticipating problems. I think that this is an exciting project. I think the goal in this project is to give us a better connected economy, a more regionally balanced economy. This is a really, really important initiative. We have a project board and the different levels of guidance and governance around the project, and of course payment will be dependent upon delivery, and that's the most important element of this. I don't anticipate problems. There are always glitches in life, but I'm looking forward to a smooth rollout, and that by the first 6 to 9 months of next year, that 19,000 properties in Northern Ireland that commercially would not have received this level of broadband will have it in their own homes. That will make an enormous difference.
I call Cathal Boylan.
Well, good lashing, thank you, Mr. Deputy Speaker. And could I welcome this announcement today? And the Minister knows that we've had a number of conversations in the corridors in relation to this project. I just want to be a wee bit selfish and ask about Newry and Armagh, the number of premises in Newry and Armagh targeted and the time frame for that. And more importantly, Minister, that this project is rolled out to most of those premises in the open countryside that has been waiting a number of years for broadband provision.
The member opposite and I clearly understand how absolutely important this is for rural communities across Northern Ireland and for the economic opportunity that this can bring to rural communities across Northern Ireland. Project Stratum for Newry and Armagh will target 8,101 premises in the Newry and Armagh constituency. And that will give an average coverage that have access to next generation broadband in that whole constituency of 99.5%. That's a pretty good record when we reach it.
I call Pam Cameron.
To number 3, please.
Can I thank the member for her question? I fully appreciate that many pubs have been asked to close under the regulation and as a result have had no income or limited income. It is vital that we provide support to prevent permanent pub closures and job losses. That is why I want to see these businesses receiving this additional top-up support as soon as possible. My department has been allocated a funding envelope of €10.6 million and is designing a scheme within that budget which will go forward to the Executive for agreement. The aim of the scheme is to provide compensation to wet pubs that were required to remain closed under the health regulation restrictions for a further 12-week period from the 4th of July to the 23rd of September, when the rest of the hospitality sector were permitted to open and trade.
I call Pam Cameron for supplementary.
Thank you, Mr Deputy Speaker, and thank the Minister for her answers so far. I'm sure the Minister will agree that longer-term financial support may well be needed well into 2021 to assist the hospitality industry back onto its feet and protect those jobs following so many months of lost income this year. Can I ask the Minister how we can help the sector recover next year once the rollout of the vaccine is at a more advanced stage?
I'm on record many times in this House as saying that the best way to help the economy is to have an economy that is open, that is functioning, and where people can go about their daily business. We are in the midst of a health pandemic. That sadly has brought great suffering, I think, to the hospitality sector, and particularly to these traditional pubs who have not been able to open for pretty much most of the year, maybe bar a week or two in late September, October. And therefore, that is why it is incumbent upon us to try to bring the support to them. I will be bringing forward the scheme to the Executive, hopefully this week. We are waiting on details of verification checks, and I know that the member will appreciate that it will have to be done in a way that we can authenticate applications and check them. Thank you.
I call Kiva Archibald.
And I thank the Minister for her responses so far, and it will be welcome news to the sector that is hopefully going to the Executive this week. All of these schemes are really very welcome, and last week the newly self-employed criteria were published and that scheme opened, and it became apparent that some people will still be excluded on the basis of the criteria, in particular in relation to the requirement for 50% of the trading income to have been from self-employment in 2019-20. And this will exclude those who became self-employed later in the year. Would the Minister commit to looking at that particular criteria to ensure those who previously missed get paid?
Well, I am, of course, going to provide a full answer in relation to the self-employed scheme. We launched the scheme specifically to deal with those who had access to any interventions whatsoever. We have employed the same criteria broadly as the schemes in Scotland and Wales, and therefore is in line with the criteria in the CESS self-employment scheme, and therefore that is why the scheme is designed and launched in the way that it was. We are, of course, always willing to look at any of these issues, but we would need to have a rationale, and the reason for the 50% is to make sure and protect those who are genuinely self-employed, that this is their main source of income.
I call Steve Aiken.
Thank the Minister for her answers so far, and indeed with the Minister and the Deputy Speaker's indulgence, I would like to ask the question Are the Executive looking to provide some sort of grant support for licensed sport and social clubs to help them make it through the rest of the winter? And could she indeed join me in welcoming and wishing Mr Stuart Dixon a very happy birthday?
That is stretching the question, but I'll pass that to the Minister to decide if she wishes to respond.
Mr Deputy Speaker, I could not resist. I'm not going to sing it, but I wish you a very, very happy birthday. And given all the challenges that you've been through, it's very welcome. So he's always willing to embarrass you at every opportunity, isn't he? Yes, those licensed premises who have been closed and have been instructed to close will be available to apply in the same way as others who have applied for other grant schemes.
Moving on, I call Cara Hunter.
Thank you. Mr Deputy Speaker, question 5, please.
Thank you, Mr Deputy Speaker. Thank you for the question. The Executive has agreed a funding allocation of £10 million to support the newly self-employed. The newly self-employed support scheme opened at 6 p.m. on the 3rd of December and will provide financial support to newly self-employed individuals whose business is adversely impacted by COVID and have not been able to access support from the UK Government's Self-Employed Income Support Scheme. The scheme will provide a one-off taxable grant of £3,500, enabling support for approximately 2,900 newly self-employed individuals. Invest Northern Ireland will deliver the scheme on behalf of the Department for the Economy, and the scheme will close to applications at 6 p.m. on the 7th of January 2021. At scheme closure, any underspend will be considered and a top-up grant may be paid to eligible applicants. Details of the eligibility criteria, along with an eligibility checker, can be found on the NI Business Info website.
I call Cara Hunter for supplementary.
Thank you, Mr Deputy Speaker, and I thank the Minister for her answer. Minister, can I ask if, in addition to the support scheme for the self-employed workers, if your department is any further forward in developing a scheme that directors of limited companies can avail of?
My department is indeed in the process of developing a scheme for limited companies. Again, this is one that we want to discuss the eligibility with various business organisations who deal with these issues. We're in the process of doing that and will continue to do so as quickly as possible. May I put on the record, Mr Deputy Speaker, today that currently in my department we're managing the COVID restrictions scheme, Part A and B. We've launched the self-employment scheme. We have almost finished working up the scheme for traditional pubs. We have a scheme waiting for large hospitality, another scheme for bed and breakfast businesses, and of course we are working very, very much on the High Street Stimulus scheme. And I want to pay tribute to the officials from my department for the work that they are doing to support businesses in Northern Ireland. That is an enormous workload on top of all of the other day-to-day issues.
I call Christopher Stalford.
Thank you, Mr Deputy Speaker, and also can I associate myself with the comments of Mr Aiken, although I wouldn't dare to guess what birthday it is that Mr Dixon is celebrating. I wouldn't wish to offend or compliment him in making a guess at that. The scale of the challenge that the Minister faces in stimulating the economy is reflected in the fact that she put a bid in for £390 million and received roughly a third of that from the Finance Minister. And this is not real money in the sense of the economy generating actual new money. This is government money that will ultimately have to be paid back. Does the Minister, can the Minister today commit to using her influence and power in the Executive to push for the fastest easing of restrictions on economic activity that safety will allow, because it is absolutely essential that our people are allowed to get back to work?
I think the member and members across this House will be absolutely in no doubt that a fully functioning economy is required to be open, to be devoid of restrictions, etc. But I do recognise that we are in the middle of very difficult health circumstances, and my advice would be, like my colleague Robin Swan, to advise people to be respectful of each other, to remember the rules, wash your hands, keep your distance, wear your face mask. If we do these things, then we can have an economy that is freer and more open and able to trade. And I noticed today that the first woman in the world to receive the vaccine, although she lives in Coventry, we'll forgive her for that, but she's from Northern Ireland, and I take that as a great sign of hope for the future, recognising, of course, that this is a mammoth challenge that we have in getting the vaccine rolled out.
I call John O'Dowd.
Minister, I want to return to the self-employed and the newly self-employed. I understand that representatives of the self-employed are bringing forward proposals to the Minister which would in fact meet her objectives of ensuring that the public purse is protected and that money is going to those most in need. Will the Minister take those proposals seriously and undertake to assist those who are newly self-employed?
I think the member knows well enough that I receive delegations of people from right across the spectrum of Northern Ireland, and I will treat their representations to me with respect and look at all of the suggestions that are put forward.
Rachel Woods is not in her place. We now move on to I call Rosemary Barton.
Question 7, Minister.
Can I thank the member for her question? Given the tweets that we have just seen and some of the issues that have been aired today, it is indeed very, very timely. Since I took office, my priority has been to ensure Northern Ireland businesses continue to enjoy unfettered access to our largest market in Great Britain. I have engaged with our government on a regular basis to ensure this, and I am pleased that those efforts are yielding results. Unfettered access can be guaranteed by the United Kingdom through the Internal Market Bill, by agreement in the Joint Committee, and I note the latest reports. But I also note and I think this House should note, that I spoke to businesses this morning and all agree that a pragmatic and practical outcome is absolutely desired. The SI covering goods from Northern Ireland into GB is, in my view, too vague. It is not a fulsome definition of a Northern Ireland qualifying good. And while international trade, including which measures will be taken to ensure that EU goods do not use Northern Ireland as a backdoor to the GB market, are for the United Kingdom Government, it is important that the quality and provenance of Northern Ireland goods is preserved. The Government has yet to outline specific anti-avoidance measures which would be used against EU businesses who are attempting to avoid tariffs through bringing goods into Northern Ireland. I welcome the commitment to developing a sustainer longer-term qualifying definition and anti-avoidance measures. Engagement with industry and the Executive on this is essential. The Executive has written to the Government supporting proposals from NIFTA, which would act as an effective model for the agri-food sector, ensuring unfettered access.
Call Rosemary Barton for supplementary.
Thank you, Minister, for your answer so far. Minister, can you advise on the country of origin of goods that have been produced using products from several countries? For example, cheese or Bailey's drink, etc.
The member will be glad to know I actually spoke to the Chief Executive of Dairy UK this morning in this very precise issue. And I'm presuming that the member refers to milk in Northern Ireland, maybe processed in the Republic of Ireland into cheese, etc., etc. And we do need a practical outcome to this so that it is treated, if it's done in this way, as a product of origin of one or other. But most importantly, what we need to ensure for all of our produce is that we have free access to the EU market in this respect, but that we also have access to our biggest market. And again, I'll repeat it because it's worth repeating. Northern Ireland sells more in the Great Britain market than it does in the Republic of Ireland, the rest of Europe, and the rest of the world all added together. That unfettered access to GB is absolutely vital.
I call Declan McAleer.
Margaret, and I thank the Minister for her answer. The Minister made reference to the anti-avoidance measures that the British Government are supposed to put in place to prevent the North becoming a back door into the British market. That has the potential to become a huge impediment to trade from heading east, and there's only 23 days to go towards the end of the transition period. Does she have any assessment or any sense of what shape these anti-avoidance measures might take?
Well, as I said in my answer to the question, the Government has said that they would bring in anti-avoidance measures. I think those are likely to be measured around asking firms to prove that they are not using a particular route through Northern Ireland in order to avoid duty on the particular goods that they are bringing into the GB market. For Northern Ireland, there are a couple of things that are massively important. We want to preserve our place within the United Kingdom's internal market. As I have said, it is the most important market for Northern Ireland, and I know the member will be extremely interested for agri-food in particular. It's absolutely vital that we preserve that place. Equally vital that we preserve the provenance of Northern Ireland goods, so that Northern Ireland isn't seen as a bit of a backwater, a backdoor, where anybody and everybody can bring goods in to the GB market. I think that would undermine us in the GB market and undermine the value and provenance of Northern Ireland goods, and that is massively, massively important as well.
I call Matthew O'Toole.
Mr Deputy Speaker, I don't know if the Minister's seen, but in the last hour there's been news that at the Joint Committee there's been some agreement going forward. She, like me, will want to see the detail of that agreement between Minister Gove and Vice President Šefčovič. But can I ask her, pursuant to that, once we see the detail, is she willing, with others in the Executive, to press for full access for Northern Ireland businesses to existing EU trade deals? That's something that via the Joint Committee we should be able to agree that we do get that access both to UK deals and of course the UK market, and I agree with her on that, but also those existing EU trade deals. That offers real opportunity for businesses here. It's also essential for businesses, particularly the dairy business. Thank you.
I think the Chief Executive of Dairy UK will be very pleased that we were listening to him this morning. I, like you, will want to see the detail of what has been agreed. I have read the statement that has followed the discussions this morning that have been ongoing for a number of days. And as I've said in this House on many, many occasions, for Northern Ireland, for the rest of the United Kingdom, it would be better if we were able to achieve that zero tariff, zero quota deal. And I think that we need the practical outcomes for the protocol to be agreed. As I said in an earlier answer, we can do them either through the Internal Market Bill, but we could also do those with the agreement of the EU through the Joint Committee. So I will be very interested in the outcome of those discussions today, and particularly when the Minister makes a statement to the House tomorrow in relation to those. It is important on trade deals that we have access, and this is a huge, huge issue for us, that we have access to those trade deals that the United Kingdom will do as new. Of the 37 trade deals that the EU has, most of those, bar I think about 3 now, are actually rolled over. So as members of the United Kingdom, we will have automatic access to those EU rolled over trade deals. What we really need to make sure is that we have access to the new trade deals, that trade deal with the US, that trade deal with New Zealand, that trade deal with Australia, and that we have that access on the same basis as every other part of the United Kingdom.
And that is the end of our period of time for listed questions, and we now move on to topical questions. And I call Paula Bradshaw.
Thank you, Deputy Speaker. Minister, can I ask what proposals you have to bring forward a scheme to assist PAYE earners excluded from both furlough and from the newly self-employed support scheme? Thank you.
I'm presuming the member means the self-employed scheme, the CESS scheme, the national scheme, and the scheme that we currently have. Well, as I have indicated, we have launched a scheme for the self-employed. That's for those who became self-employed after March 2019 and therefore 2019, and therefore could not have supplied a tax return to HMRC before COVID struck us in March 2020. The scheme that we have brought forward is broadly the same scheme as that was developed in Scotland and in Wales. I look forward to those who have not been able to access any support, being able to access support through that particular scheme. Those who, and I'm presuming again that the member is talking about those people who were maybe became self-employed, say, in 2018 or maybe late in 2019, for whom CESS has not been a particularly successful outcome. Those are not included within our scheme. Those that would require a completely separate scheme. Of course, that will be up to the Executive to decide whether they will, because then they will be getting into the position of topping up national schemes, and they will have to decide whether that's a position that they want to get into and whether the Finance Minister has the funding for the same.
I call Paul Bradshaw for supplementary.
Thank you, Minister, for your response. There is the correspondence I've received from constituents recently, including where they're frustrated that when they've applied for the self-employed support scheme, is that there seems to be a mismatch in the definitions used between the Go For It programme and what the department are using in terms of eligibility. Is that something that you could look into? Because a lot of the people who fall between the cracks, as you know, Minister, are in very dire straits, and this is having such an impact on their mental well-being.
I am completely aware of how difficult life has been over the last number of months, and that is why in the 3 support schemes that we brought out in the early part of the year, we paid out over £340 million to those individuals who required help. I am absolutely also aware that that didn't cover everyone who needed help, which is why we have now specifically targeted that particular group of the self-employed who were not able to access the national self-employed scheme. And that's a very, very important distinction. The criteria was developed in line with the criteria that the group excluded, the excluded group had actually brought forward, and is in line with the criteria that was used in both the Scottish and Welsh schemes of the same nature.
I call Gary Middleton.
Mr Deputy Speaker, the Minister will be aware that there's a lot of media attention around the discussions and the agreement around the UK and the EU and the Northern Ireland Protocol. Would the Minister agree that it is vital that an overall trade deal is reached to support our businesses here in Northern Ireland? And does she support a flexibility or a grace period for local companies as they try to adopt new arrangements post 1st of January?
Can I thank my colleague for the question? It is important that we reach a deal. I've said many times that is the best outcome for Northern Ireland, and it is important that we reach a conclusion to the issues that the protocol have thrown up for Northern Ireland. I don't support the protocol. I'm not pretending about it to anyone in this House. Everyone knows my view. But we have practical issues to resolve for the good of the business community and the economy in Northern Ireland, and to support jobs, and that's important. I spoke to my EU stakeholders group this morning. That's made up of a very wide range of businesses across Northern Ireland, and we agreed that with the statement of the business leaders yesterday, that a period of ease, of adjustment would be necessary, given the lateness of the hour of the agreement. And of course, we will reserve judgment on the agreement until we actually see the details of the same.
I call Gary Middleton.
Can I thank the Minister for her response, and I do welcome the comments that she has made. Like herself, I think it is important that we do wait and see the detail. But will the Minister continue to raise the concerns around the protocol? This morning I met with airlines along with colleagues, and they raised some serious issues about the impact of what the protocol will have on them. So will the Minister commit to continue to raising those issues on their behalf?
I absolutely will. I think that what we will possibly see from the discussions in the Joint Committee are high-level agreements that will come out over the next number of days. But underneath that, there are always a myriad of practical issues that need to be resolved that the protocol has imposed upon us. And for those in this House who call for the full implementation of the protocol, I would advise you to step in my shoes for just a short period of time and listen to the difficulties of businesses who struggle with the complexities of customs and health export certificates and the costs to businesses. And again, very importantly for this House, and something that we need to keep our government reminded of, is the cost to business and the promise of our government to actually make sure that businesses do not have to bear that cost themselves.
I call Pat Sheehan.
Cian Corla. Minister, the black taxis play a very valuable role in the tourism sector in my constituency and indeed in other constituencies in Belfast. These drivers provide guided tours for tourists throughout the city, which in turn benefits hoteliers and other accommodation providers. And while you have provided multiple grants to hotels and accommodation providers, you continue to exclude taxi drivers and the coach industry. And I wonder, would you give a commitment today, Minister, to amend Part B of the Coronavirus Business Support Scheme so that taxi drivers and coach operators can access additional payments on top of the rather meagre payments they get from the Department of Infrastructure?
Well, of course, the member will understand that the responsibility for looking after taxi drivers, coach and haulage industry is with the Department of Infrastructure. They're the department that regulate the same, and they're the department that have brought forward the scheme in relation to the same. The scheme, the COVID restrictions scheme, is meant to look after the supply chain of those businesses that are named within the restrictions. So they have to be named and they have to be in their direct supply chain, i.e. have a contract with that. However, the best way to support the taxi drivers is to have an open economy, a free economy, and of course, absolutely, and one of the most utmost priority pieces of work that we will do in the next year is to restart and reboot our tourism economy so that we can see those people come back to Northern Ireland, and we will make sure that jobs in that sector are secure for the future. I believe we have a lot to offer in Northern Ireland for tourism, and I look forward to working with the sector to see that renewal, and I hope to make announcements about that in the near future.
I call Pat Sheehan for supplementary.
I've got Cian Corla, and I have to say, Minister, I'm very disappointed with that answer. Taxi drivers in particular, who under normal circumstances work very long and antisocial hours for very little recompense, have been left behind in this pandemic. It took a long time to get the scheme from the Department of Infrastructure launched, and you have the power.
And has the member a question?
To amend Part B of the Coronavirus Business Support Scheme, which would ensure that taxi drivers and coach operators get additional payments.
I certainly sympathise with either taxi drivers or coach operators. Since there is already a scheme where they have made their application, where those applications have been verified, if the Executive decides that there should be additional funding for that scheme to satisfy additional hardship payments, I of course would support that.
I call William Irwin.
Deputy Speaker, I'm sure the Minister is aware the impact of COVID on the economy has been unprecedented. I understand that a number of initiatives exist to help people stay in work or find new employment. Is Northern Ireland part of the Kickstart programme that was launched in GB?
Can I thank the member for his question? And much of what we do in the Department of the Economy is to support the broader economy and to support training and initiatives within the economy. That's why we launched our apprenticeship schemes, which are being received well by industry, creating new apprenticeships and supporting others. Kickstart is the Department of Economy scheme, no, Department of Community scheme, sorry, Department of Community scheme. And I did speak with the Minister some months ago when Kickstart was announced in the United Kingdom. I understand that she is working up a scheme, would be encourage her to bring it forward as quickly as possible.
Call William Irwin for supplementary.
I'm sure the Minister would agree with me that it is vitally important that every effort is made to help many of these businesses.
Absolutely. Make sure that it is really important to help businesses. It's really important to help individuals as well. And perhaps the House, in the closing minutes of this question time, might want to know that Part A of the COVID restriction scheme has received 3,603 applications, and to date, 2,544 of those have been paid, with over 12 million being given to individuals in this period of restrictions, and we hope to have all of the scheme in Part A fully paid out by the end of the week, except for perhaps the one or two that are very much more difficult to do. Part B of the COVID restriction scheme will start paying this week, with significant payments today and on Friday.
I call Daniel McCrossan.
Thank you, Deputy Speaker, and thank you to the Minister for the answers to the questions so far. Minister, you've answered questions in relation to Project Stratum, and I want to add my full support to that project and the progress in terms of Fibros being given the contract. I am, however, somewhat concerned about the timeline in terms of increasing broadband coverage in West Tyrone and Fermanagh and South Tyrone. Given that these constituencies are somewhat the worst impacted in terms of connectivity, Minister, can you give your assessment on the need to prioritise both of these areas in terms of the rollout?
Well, of course, I've made my view very clear on this, and the contract was awarded so that the company that would get the contract would be able to roll out the contract in a way that made most economic and technical sense. If we start to actually prioritise one area here and one area there and one area somewhere else, then what we will do is we will make the contract more expensive, and less homes and premises will be included within the contract area. I, like you, and for my constituents who also need to see broadband in their particular area as quickly as possible, would like to see me being able to chop and change things around. That's not the way it's going to work. We are rolling it out in the most economic and technically sensible way to get the most that we can and the most premises that we can from the contract.
I call Daniel McCrossan for a very quick supplementary.
Thank you, Minister. West Tyrone was somewhat worse, but I do understand we have to defend our constituents. Minister, can you outline whether any assessment has been undertaken with the Minister for Education, your colleague, on the impact of Project Stratum will have in terms of boosting broadband connectivity in rural schools?
I haven't specifically spoken to the Minister of Education on this particular issue, but we all know that connectivity is key. It is king, and fibre is the new method of connectivity. And that will bring, and Project Stratum will bring, economic opportunity to your constituents in West Tyrone on an equal basis to those who live in more larger urban settlements. I think that's a good thing, and a good thing for families and farm and jobs in the West Tyrone area. And I look forward to seeing it roll out.
And that is the end of our period of time of questions to the Minister for the Economy. I would ask members to take their ease for a few moments.
Okay, members, we now move to questions to the Minister of Education, and I call. Sorry? We don't take points of order during question time, Robbie. Sorry about that. I'll take me later. I call Liz Kimmins to ask the first question.
Thank the member for her question. It is my priority that examinations towards CCA qualifications, which is the one area that I have direct control over, should go ahead as planned in 2021. However, it's clear that there is a need, and I've acknowledged this from the start, of adaptations given where we are this year. The first suite of adaptations, which I agreed on the 9th of October and then subsequently on the 6th of November for GCSE qualifications, provide a significant reduction in the burden of assessment for young people while still allowing as much opportunity as possible to cover the content of the specifications. I'd also, at that stage, agreed a number of health-related adaptations for AS and A levels. However, the situation has been kept under review, and my officials have been working closely with CCA to develop a range of further mitigations and contingencies to respond to the fluid public health situation. That is particularly the case for AS and A levels. That work is in an advanced stage and has also involved discussions with key stakeholders in terms of partnership at school principal level, and I hope to be in a position to be able to provide more information on that issue very soon.
Supplementary, Liz Kimmins.
Thank the Minister for his answer. And having read the public exam guidance that was published in November, I and many others would still be deeply concerned that the Minister and CCA continue to ignore the concerns of young people, their families and teachers. There will be no level playing field when it comes to the public exam series for next year, and many young people will have had multiple periods of self-isolation as we move forward, so the education experience is very varied. Will the Minister consider directing CCA to add greater optionality on the exam papers for 2021 to try and reduce some of the stress felt by our young people?
And I suppose, as with a lot of things in education, sometimes it depends what you define as a particular term. Optionality, as it's been generally speaking considered within a pure educational point of view, which is generally speaking the issue of having more exam questions from which to choose. There has been direct concerns have been raised. That's one of the options that has been looked at and continues to be looked at. There is a concern that optionality itself in that definition then can sometimes be regarded, indeed there has been particular concerns raised by particularly non-selective schools, that optionality in the way that it would be referred to would create problems, particularly for some children with special educational needs and candidates who academically would not be as strong and so therefore could potentially discriminate against them. However, as regards that, there are a range of other options, if I can put it that way, for a range of adaptations, particularly that I'm hoping to bring forward. Specifically on GCSEs, the situation in many ways we've already gone further in terms of adaptations that would have happened in some other jurisdictions, particularly England. So there will be a range of options which, as I said, I hope very soon to be able to come to a conclusion. I would hope to be in a position that there could be further announcements before Christmas to give people those levels of certainty. It has got to take account of the current wider situation, because it is about trying to create as level a playing field as possible. I think in current circumstances, whatever direction myself or indeed any jurisdiction moves in does not create a complete level playing field for anyone. I think that's part of the difficulties, because sometimes in making one particular decision, you make something fair for some and unfair for others, so it's about trying to balance that out. But I hope to be in a position to reach a final conclusion on that fairly soon.
Daniel McCrossan.
Thank you, Mr. Speaker, and thank you, Minister, for the answer to your question. Minister, I'm very, very concerned. I've put firmly on record my concerns in relation to examinations going ahead, particularly given what happened in the summer and the impact it has had on the mental health of our young people and of teachers in schools. Minister, you're in the bad books of a lot of students and of a lot of teachers, and I think you know that very well. Will the Minister now, given the situation, given how the Children and Young Persons Commissioner has spoken out and the Mental Health Champion, will you cancel examinations this year?
No, I won't, because frankly, if we're talking about fairness with people, we've got to take into account, first of all, that the exams that I control will be CCA. So you would immediately, if we cancelled all CCA examinations, put that in a different position from the roughly 20% of students who are doing English board examinations. It would place students in Northern Ireland in a different position, not just from students in England, not just from students in Scotland, Wales, and indeed something which may be potentially of greater interest to the member, the Republic of Ireland, who are going ahead with the examinations as well. Every jurisdiction, by one means or another, is going ahead with examinations. Now, the point is, we need to ensure that in terms of grading, we have a level playing field, particularly throughout the United Kingdom. We need to ensure that students are on a level playing field as much as possible amongst themselves within Northern Ireland. But also we need to have a situation that if we are the only jurisdiction that in all forms was abandoning examinations, where would that leave some of our students when making comparisons when it comes to university places and obtaining those places? So, rather than snatching at a populist headline, we've actually got to think this through as to where it actually leaves our students in that regard. And the one thing I'm going to do is be absolutely straight with students because, and with others, Wales, for instance, and I'm sure that members will raise this, will say, well, Wales have abandoned exams. Well, they haven't really, because what they have done is they are having external assessments, externally set, externally marked, and presumably if there's going to be a level playing field between students in Wales, that will have to be under examination conditions. So in many ways, if it walks like a duck, if it quacks like a duck, it's a duck.
Robbie Butler.
Thank you, Mr Speaker. Minister, we're now on the edge of Christmas break for schools with no certainty as to a return date due to the potential for increased COVID transmission over the festive holiday. What impact assessment has your department carried out on the extent of lost classroom learning, particularly for years 11 through to 14?
Well, from that point of view, adaptations which will be put forward will be ones that will cover the situation, which will recognise that not every student has faced that, and we'll also need to look at where we can also, within a wider UK context, deal with special considerations for individuals. I would say, because again, as with Northern Ireland, perhaps unsurprisingly, rumours will always abound. There's no plans to delay the return to school in January. I want to see as full a opportunity for our young people to have that direct education as possible. So let's make sure that there aren't rumours started which, again, don't have any substance to them.
Questions 2 and 7 are withdrawn, and I call Chris Little for the next question.
Question 3.
I thank the member for his question. I wasn't actually aware the question 2 had been withdrawn. Can I say in relation to that, obviously, as the member will be aware, the setting of admissions criteria by law is a matter for boards of governors of individual schools. And indeed, there was guidance being issued to all post-primary schools on the operation of the transfer procedure to assist in the process. However, given, I think, the unique situation that we find ourselves in, I have also written directly to the Board of Governors of schools that will be using the entrance test results in their admissions criteria. I have advised, and schools are, I'm sure the member will be aware, under an obligation that they are then to publish criteria and produce that certainly by the 11th of December. What I have said to them that where they are drafting criteria, that boards of governors should consider any eventuality where test results are available, but not necessarily for every single student. And as such, I've indicated to them that as part of their overall criteria, they should look at, first of all, as part of that single set of admissions criteria, how they deal with the students that, for instance, have had to self-isolate and maybe not able to do all the tests. That will also be, I think, they'll be working alongside the test providers. And also, I think, I've asked them to, it is also the case that the schools will each year also apply special circumstances. And I've asked schools as well to review their special circumstances, because I suspect there will be a greater call on those this year than in previous years. So while it's for individual schools to determine how they will deal with such applications, once those criteria are completed, they will be published directly by the Education Authority at the beginning of the new year.
Just a little supplementary.
Thank you, Mr Speaker. Just bring up my microphone here. There we go. Thank you, Mr Speaker. The Education Minister has failed to introduce a dedicated code to gather COVID-related pupil absence data, but the National Association of Head Teachers surveyed 89 primary schools in November and found on average as many as 37% of P7 pupils have experienced a COVID-19 related absence since the start of term. So can I ask the Education Minister yet again, how can it be fair to base post-primary admission on the basis of testing 10-year-old children in such exceptional circumstances?
I do admire the member with the inventive ways his attacks on academic selection seem to take slightly different twists and turns in relation to that. And under the cover of COVID is now the route in relation to that. The figures that we have in terms of the absences, we have direct information on those who are absent and still able to engage and those who are self-isolating. The figures, I think, from the point of view of the highest point at which that reached, which was towards the end of October, was a combined rate of around about 8%. It's a lot lower than that for most of the other weeks, and also tends to be slightly lower in primary schools than it is in post-primary schools. But again, I would say to the member that in terms of an alternative situation, and we've seen this with what has been mentioned by a few schools that are looking to move away from academic selection this year, the alternatives that they seem to have produced is whether your mum and dad went to the school, whether your older brother went to the school, where, you know, on a range of those things, it is selection by a form of family and genetics. And I believe that whatever the wider debate is there within academic selection, and sometimes it will be a question of, if you have a brother, you may get into a school, if you have a sister, you may not, or vice versa. It is accidents of birth, accidents of DNA. And whatever criticisms are there from the point of view of academic selection, at least it is on the basis of the individual merits of the applicant. And as such, while there is a wider debate which has gone on for quite a long period of time with a range of views in terms of academic selection, to jump in and put those sort of measures in place, I think is only one which will actually exacerbate difference and actually make it for some pupils utterly impossible to get into a school which is based around academic selection. Be they the greatest genius in the land, they would simply be denied because of who they were related to. That doesn't seem to me a particularly satisfactory way to select children for an oversubscribed school.
Minister, you'll be well aware of Sinn Féin's position in relation to academic selection and rejection of children. And participation in these tests shouldn't be equated to support for them. Often it's the only way that children can get into a school that's nearest to their home. So I'm wondering, what alternatives is the Minister considering to post-primary transfer this year in the context of COVID, of absences from school, of self-isolation and from mental health issues?
The point, and look, I appreciate the position of your party has been very consistent on the issue, has been very clear-cut in terms of where it comes from. Can I say in terms of that, I've indicated that academic selection, I'd be supportive of academic selection, I'm also supportive of the right of academic selection. Academic selection is enshrined in law, and the criteria that schools choose, unless they choose something which takes them outside of the law, it is up to the individual boards of governors. Now, we can give them advice which says you need to have a range of criteria to be able to look at eventualities for individuals. But it is ultimately a choice for those schools. Now, there are many fine schools that across the system that have never used academic selection, only use it partially, and also get absolutely brilliant results. And I welcome those schools as well. So I'm not intending to force academic selection on anyone on that basis. But neither am I intending to take that right away from schools. So I'm not planning, from that point of view, for an alternative. We will give advice, particularly around what is required on health and safety issues. We will give advice that schools need to be more cognizant this year on a wide range of criteria to cover those eventualities. We will give guidance which says that particularly the special circumstances that each individual school has to apply. It can't be something which can be done on a blanket basis. That those schools need to examine those closely to make sure that they are fit for purpose for this year. But I'm not going to impose a solution on those schools which takes away their right of academic selection.
Rosemary Barton.
Thank you very much, Minister, for your questions so far, or your answers so far. Minister, in regard to the use of academic selection for this cohort of pupils, can you outline any contingency planning discussions you or your department has had with the grammar schools in response to the recently successful Committee for Education's motion on the same issue?
Look, I thank the member for her question. Look, I've made it very clear that not only is academic selection is something which is there in legislation, it is also up to the boards of governors. So it's not a question of me coming up with some form of criteria, my department coming up with some criteria within that. The grammar schools who are using academic selection are perfectly entitled to do so, and I am not going to interfere in that right. Now, as I said, there are a range of mitigations that are being put in place this year, because anybody doing any form of public examination will have to follow a range of guidelines in terms of health and safety. That will apply in all sets of circumstances, but I'm not going to take that away. I will not be the minister who is seeking by the front door or the back door to destroy our grammar school system.
I call Jonathan Buckley.
Question number 4, Mr. Speaker.
Thank the member for his question. To help support schools address many of the new pressures arising as a result of COVID-19, I've announced a significant additional funding with the support of the Executive to help support the education sector. To date, extra allocations of £6.9 million have been made to the Education Authority, specifically earmarked for special educational needs pressures arising from COVID-19 and the education restart. I've asked the EA to continue to monitor funding requirements as the pandemic progresses in order to inform potential departmental bids for additional resources as required.
Jonathan Buckley, supplementary.
Thank you, Mr. Speaker. And I know the Minister will fully appreciate the devastating impact COVID-19 has had on those children with special educational needs, and join with me in appreciating their tenacity, both the children, teachers and parents that look after these young people. Can the Minister provide an update in relation to the transformation and improvement programme of special educational needs services?
I'll be happy to. Could I maybe say as well at the start, the member mentions teachers and parents. I would want to place on record, I've done so before, but I think it's important as we move towards the Christmas period, particularly for those with special educational needs, but across the board, my thanks and appreciation for all of us, for the role that parents, principals, teachers, indeed all educational staff have played in ensuring that education continues. Specifically, I think on the question that he asked, in September, the SEN governance group was established to maintain strategic oversight of the implementation of improvements being made by within the EA and the department. There's obviously been considerable levels of criticisms and various reports that have been produced, and it's important, I think, those are done on that those are answered on a strategic direction. The EA has recently established a programme of improvements through its SEND Strategic Development Programme, which provides a single coordinating governance structure for the SEND transformation agenda across Northern Ireland. The programme draws together ongoing multi-agency SEND development work, but is also defining a single strategic plan to address the wide-ranging recommendations for further change, which have resulted from various review reports across the last year or two, including the 2020 Northern Ireland Office SEND report, the SEND Learning Journey recommendations, and indeed the recent report by the Northern Ireland Children's Commissioner.
Stuart Dixon.
Thank you, Minister. Minister, could you explain to the House why the School Restart Fund does not apply to special schools, and the failure to not apply it, is that an act of discrimination against special schools?
No, it's not. And the member, maybe I'm being a little bit pedantic, I think he's actually referring to the Engage programme and Restart, because Restart is the wider package of measures that are being taken into account. As I indicated in terms of Restart, £6.9 million has been directly put in terms of special educational needs. Engage, because it is targeted across the £11.2 million at the mainstream schools, I've instructed directly, because there's more of a one-to-one intervention is required in terms of special schools, for the EA to work directly with the special schools to provide provision that would be of a similar nature to Engage. So that is why, because The way that budgets go, Engage has been delegated down to schools. As the member would also be aware, school budgets within special educational needs, and I think there's a good argument as to whether there should be a lot more flexibility put into that, but they are actually not devolved down to the schools themselves. They're handled at an EA level, so therefore I've given the instructions to EA. Whereas the Engage programme, the flexibility on how that money is used is devolved down directly to the individual schools. So that need will be met within special schools, but it will come through the EA rather than the Engage programme.
I call Karen Mullen.
Minister, the Education Committee heard evidence a number of weeks ago which suggested the Department of Health did not fulfil its obligations in cooperation with education for children with special education needs. Can the Minister give an assessment of the current levels of cooperation which exist between education and health when it comes to supporting children with special education needs?
I think we'll look at that, and I think I'd also maybe should say at this stage, I'm taking on board some of the suggestions. I know one of the suggestions, I think, to be fair, while we will often clash, I think there was a reasonable enough suggestion that came from the Chair in terms of looking at where we could develop a stakeholder engagement, I think, of a better nature and of some form of reference group for vulnerable children. I'm trying to take that forward with officials. As the member to some extent alludes to, that's not something which is purely something that can happen within the Department of Education. It is that level of cooperation. I think perhaps much of that question, to some extent, may be better answered by the Health Minister, but I think there has been good work. I think it is beginning to improve. But there's no doubt that turning the aspirations of what is there in terms of cooperation into real cooperation on the ground at times can be challenging in that regard, and it is a continual effort to be able to do that. It is why I think it is important also that as we work towards, as consultation comes to an end on the SEN regulations, that is also something which can be brought forward in terms of, particularly because allied to the regulations as well will be the code of practice, which I think will also be a driver for improvement in what we can do for our young people with special educational needs.
Call Jim Allister.
Extra resources are very welcome in this area, but does the Minister agree there needs to be better alignment between the release of resources and the further improvement of the statementing process? Present targets still remain disappointing, and you can have all the resources you like, but if you haven't got the kids statemented, then you're not marrying the two, and that's really where the solution lies.
Well, I agree with them, yes, up to a point. I mean, look, sometimes with all things, I mean, resources are required to be able to do certain things in that regard. Resources in and of themselves are not the complete picture. I mean, as such, as I think I gave answers, don't think I have the figures directly to hand, but in terms of the statementing process, there has been considerable improvements in terms of the timescales. The timescales have come down in that bit, and they started from a very, very poor base from a year or two ago. The timescales have reduced considerably. Well, you know, I see somebody shaking their head from the sedentary position who clearly doesn't have the figures either in front of me. I did reveal those at the last question time. To be fair, for once, before he gets a little bit paranoid, I'm not accusing the Chair of doing that. For once, he is an innocent man in that regard. But no, the figures would suggest that the very long-term waits. So, for example, if you go back a number of months ago, there were a number of children that were waiting, say, more than a year and a half for a statement. That is no longer the case. There have been reductions in all those elements. So it is about making that level of progress. But the member is right in terms of creating that level of alignment. And I think that is where particularly the trying to get a much more joined-up approach is actually the purpose, particularly of the SEN regulations. That's why it's out for consultation, why it's important, I think, that, that we can move ahead with that as soon and as much as we can do in terms of the resources that are there.
Moving on, I call Christopher Stafford.
Number 5, sir.
Thank you, Member, for his question. As a controlled school, the Education Authority is responsible for minor capital works within the school. So they've advised that, subject to availability of funding and prioritisation of other works, consideration is being given to progressing minor works at Nettlefield Primary. I know the member takes close interest in Nettlefield. I believe it was one of the schools that myself and the Permanent Secretary had visited, one of the earliest schools, even pre-COVID. It does seem a long time ago. But specifically, they're looking to progress minor works in the next financial year relating to the toilets, related to the roofing, and I know there's particular danger with the windows, that is one of the others, and the concrete steps outside the school office, which again could prove a hazard. All those matters are being considered for progression by the Education Authority, who will deal with the operational side of it at that level.
Christopher Stafford, supplementary.
Thank you, sir, and I declare an interest as a past pupil in Nettlefield Primary School. I am grateful to the Minister for the answer that he has given. The Minister knows that this is a unique building, and I think is actually a listed building, which complicates the need for improvement to it. But can I ask the Minister to please, as he has seen himself, the state of some of the rotten window frames and just the general poor state that some parts of that building are in, can I please ask him to do everything within his power to process this as quickly as possible and get the work carried out, because the school really, really needs it.
I appreciate that, and again, I think one of the restrictions has been with the listed status. That has not been something which is unique entirely to Nettlefield, and sometimes the listed status happens in buildings which, with the best will in the world, is not preserving some great Georgian architecture, but is holding back measures at times that need to be taken in terms of pure health and safety. Look, I would be aware that the EA are cognizant of the issues of Nettlefield. Whenever I suppose the problem is again that whenever the last call was made out for minor works, there was around about 6,000 applications. About 600 of those have been able to be funded so far. So there are a lot of demand out there, but I can give the assurance that the EA will be taking it seriously, and in no way will the fact that the member is a past pupil of Nettlefield be any disadvantage to the school.
They call Matthew O'Toole.
Mr. Speaker, I welcome the answer to the question. Though I'm not a past pupil, it clearly Nettlefield has real issues, and it's a notable building, and it really needs the work that my South Belfast colleague has asked for. Can I ask briefly about the broader capital budget in relation to the Department of Education? Has the Minister had any conversations with the Finance Minister about ensuring that the capital allocation that sits with you this year is going to be spent in year, and none of it's going to be handed back, given that it's been a unique year in terms of getting capital spending out the door?
Look, I understand that, and I think that the department was well aware of that, and as such, for instance, there has been, some money has been able to be released through discussions with DOF into, for instance, the EA on issues such as even in terms of additional bus allocation, in terms of procurement on that basis, and in terms of a range of other procurements. As much as possible, I appreciate particularly there was a level of disruption around the spring period in terms of capital spend. I think some of that has been captured back up. And in terms of the broader budget as we move ahead towards 2021, on both capital resources, while things will still be very tight across the board, I had very useful conversations with the Minister of Finance just yesterday on the broader budgetary issues covering both resource and capital demands.
Call Mike Nesbitt.
Thank you, Mr. Speaker. I'm sure the Minister would join with me in congratulating Nettlefields in surviving the many challenges it's faced down the years. I understand the Minister has visited West Winds Primary in the constituency we both serve. Would he join me in congratulating the senior leadership team in terms of the energy they brought to school life, and also support their desire to see the same improvements in the infrastructure of the school that has been seen in other primaries in the area in recent years?
Yes, certainly I would congratulate, I think, the hard work and success of the school, not just obviously under its current principal, but under the previous principal as well. I think it has been a success story, and particularly a beacon of success and light. I should perhaps indicate, then just in keep people are checking the register, so to speak, that I visited in the capacity, I think, as the member did as well, separately in my capacity as an MLA for the area, rather than my capacity as Minister for Education. I was able to view, I think, some of the challenges that are there, some of the improvements that need to be made from the physical infrastructure, and certainly speaking as an MLA, I'm very much in favour of those, and indeed I want to see the best possible availability of space and construction for all our pupils, not just in the great constituency of Strangford, but beyond the constituency throughout Northern Ireland.
Call Nicola Brogan.
And I thank the Minister for his update on Nettlefield Primary School. Can I also ask the Minister for an update on the Strual Educational Campus in Omagh, which is my constituency of West Tyrone, please?
The member will be aware from that there's a determination to carry. I should first of all, I suppose, this is the first education question time, and I suppose I'll be seeing her tomorrow at the Education Committee. Welcome her to her place. Work is continuing to go on with that. Recently, I'd taken a position to the Executive, which the Executive all agreed that we need to move ahead with Strual. I think there is still some work to be absolutely finalised between the Department of Finance and Treasury. It was something, again, without breaking any confidentiality, I was able to directly raise with the Finance Minister yesterday, where Finance is pushing ahead. We need, I think, a final position just of Treasury to confirm all of that, but the determination, this is probably the biggest capital project I think Northern Ireland has ever faced, and there is a strong determination, not just within the Department of Education, not just from the Minister of Education, but from the whole Executive, I think, to carry on to make sure that this is brought to fruition.
I call Chris Little.
Thank you, Mr. Speaker. Can I ask the Minister what the monetary scale is of the maintenance backlog across Northern Ireland?
I don't have those figures directly to hand, but I'll be happy to provide those to the member.
That ends the period for a list of questions, members, and we will now move on to 15 minutes of topical questions. And I call Trevor Lunn.
Mr. Speaker, could I ask the Minister if he has read the excellent independent report on integrated education yet? And if he has he any initial comment to make on the recommendations it contains?
Well, yes, of course I had read the report. Indeed, I had to take some, I was going to say, imaginative action to make sure that it was actually published on time from the last mandate, because I think it was actually produced in terms of its final version during the period of PERDA. So I had to make sure then it was able to be released. I think actually to cover the situation, we were not supposed to release anything in PERDA. I remember actually it had to be released at 10:15 on election day in 2017. So yes, I have read the report. There have been a number of the recommendations have been put into place. There is also, I think, reference that it would be one of where there is outstanding recommendations, and maybe that in terms of recommendations, a number are sort of part of a wider picture. Some may not be 100% appropriate, but the consideration of that would be in the wider revised draft terms of reference that hopefully will be part of the independent review, and I'm hopefully bringing I've submitted a paper to the Executive on that, but it would mean then that any independent review would take forward anything that is outstanding from that.
Trevor Lunn, supplementary.
Yes, I thank the Minister for his answer. I'd like to refer him to recommendation number 17, which suggests that his department should be more proactive in advising schools about the transformation process. Is he satisfied that the department historically has delivered on its statutory obligation to facilitate and encourage integrated education?
Well, I should say that while history was one of my favourite subjects at school, and I suppose it's something which is always a lot of politicians in Northern Ireland will always get accused of being immersed in, I'm not really think there's a great deal of point in trying to retrospectively decide what should have happened 5 years ago or 10 years ago. I think trying to meet the challenges of where we are now is probably the more appropriate bit. And as I indicated, as part of the outstanding recommendations, we'll look at what is appropriate then to be put in place and how it can be put in place will lie with the independent review that hopefully will soon be initiated.
Caller Leah Flynn.
And I would just like to state first of all that I welcome the recent announcement from the Minister, the £5 million that was going towards schools to help support students with their mental health and well-being. Although, if I'm correct, 1.5 million of that came from the Department of Health. So my question to the Minister is, does he think that that amount of £5 million was sufficient, and is he planning to submit any further bids in relation to this?
Thank the member for your question. There's actually two funds, and she may slightly be mixing up the two. The £5 million that was recently allocated, I think strictly speaking 4.75 million of that was directly to schools. The other £250,000 was particularly the youth services, because obviously there would be gaps there within that. That was specifically money that I'd put forward as a proposal. The Executive then endorsed that and provided that money via the COVID side of things. The 1.5 million that she's referring to, there are plans to have a wider embedded 6.5 million within budget. That's in addition to the 5 million. And the 6.5 million would be from mental health and well-being, with that contribution from health because of the level of crossover issues that are there. And the aim would be for that to roll out in the new year. Whereas the 5 million for COVID, and there's no doubt while there may be some possibilities to look at what could be done next year, while COVID funding will still be available in 21-22, as I'm sure the Finance Minister who's here would indicate it's of roughly about a quarter of what it was in total. So there's still the possibility to bid for some further element of COVID money. But I think the aim is, in addition to the COVID money, to have something secured within the budget that will be there on a rolling annual basis. Of the original £6.5 million that will be intended, as this is the first year of this additional funding, some of that will be on a levels of pilot programming, because we have to actually see what works in practice, what, I suppose, if you like, may work in West Belfast won't necessarily work in West Tyrone, what works in a primary sector, what works in a special school, what works in a post-primary may not be the same. So part of it will be a certain level of testing out and then trying to embed what is very successful, and maybe there will be a level of shift of resources.
Leah Flynn, supplementary.
Yes, and I'd like to thank the Minister for his response, and maybe if the Minister could outline then the time frame also for the delivery of the emotional health and wellbeing framework, and if the Minister can commit to making this an urgent priority coming into the new year of 2021.
I think in terms of the framework, this would, I suppose, try to marry in the two issues, so it would be early in the new year, would be for both.
Call Michelle McElveen.
Mr Speaker, and from the outset, as it's pertinent to this question, I'd like to declare an interest as a Governor of Nendrum College in Cumber. Could I ask the Minister if he can provide an update on any discussions being held in relation to controlled post-primary school provision in the arts area?
Thank the member for her question. There have been, as the member is very well aware, there's been pressure on places, particularly some of the post-primaries in the arts area in recent years. In light of this pressure to meet that, there was an allocation of 90 extra places across the Strangford constituency in advance of the 2020 process. We tried to some extent to get ahead with that. Now, there will be some reduction in the pressures in 2021 because there's a smaller cohort that will be transferring. So, in addition, I've put an initial 10 places on in advance of 2021, but my department stands ready to allocate further temporary variations. Obviously, for permanent change, that would then require a development proposal to take place. What I would say as well is that to try to judge where there are pressures within the area, I want also across the board in Northern Ireland to also look at a new policy of a level of right-sizing and normalisation, as it's called, so that if a number of schools, for instance, have year-on-year issues with getting temporary variations, that can be taken into account. Now, I think legally the definition for development proposal will be a significant change, but it strikes me that where we are getting scenarios where that is simply reflecting what has happened on the ground, that will need to be put into place. Obviously, very specifically as regards any development proposal itself, would come as a legal process to which myself, as Minister in the Department, would have to then give a direct verdict on, so I obviously couldn't comment on any individual development proposal.
Michelle McElveen, supplementary.
I thank the Minister for his response. Both parents and pupils are keen to have post-16 provision at Nendrum, and Glastonbury College is long overdue a new build. Could the Minister provide an update on what consideration is being given to both of those projects?
Well, at the moment, again, if there was, for instance, a change, I suppose it would be a significant change, if we're moving to a scenario in any particular school where there is a sixth form provision as opposed to then school ending at 16. I don't have any particular problem with that per se, but obviously that itself would come as a development proposal. As the current situation, obviously then any development proposal will need to come through the managing authority. Currently at present, there hasn't been any published DPs for either Nendrum College or Glastonbury College from the EA. And if that was something then to be considered, it would have to be initiated through those organisations. It may be that, and again, perhaps it's been overtaken by other events, the member may want to raise that directly with the new chair of the Education Authority, Mr Barry Mulholland, who's been announced today.
Call Emma Rogan.
Minister, we are all too aware of the shortcomings in recent years in terms of administrative and operational processes involving the provision for children with special educational needs. The new SEN framework and the associated regulations and the Code of Practice will hopefully represent a new beginning in supporting these children and their families. Can I ask the Minister to outline a time frame for the full implementation of these new arrangements?
Well, the current arrangements are indeed in terms of the SEN regulations and the code of practice. I think it's something that all of us would welcome. It is out in terms of the fine detail. Concluding it's the end of consultation will be before the end of Christmas. I would hope to move ahead with that in as full a way as possible as soon as I can. I think the only issue, which again I would urge members around the chamber to support, there will be a significant financial investment that will be required. So that at present there has been within this year's budget around about £7.5 million has been directly allocated to that. A full year cost will be £30 million, and so therefore either resources will have to be provided or be found. The speed of movement on that to some extent will depend upon the wider financial settlement that we're able to reach, and I know at least in terms of draft budgets, and I believe the Finance Minister is hoping to bring proposals to the House fairly soon. I think, to be fair to the Finance Minister, we are next year going to be potentially in quite a difficult situation across the board. Because we are effectively, once you take out a particular elements of COVID, or I think at least one major ring fence side of it, the financial settlement that is being provided to the Executive is likely to be pretty close to a flatline cash, which will make things very difficult. But I think that in terms of prioritisation, implementing the SEN regulations is a critical commitment, and I will be doing everything I can to move that as full as it can, as fast as it can.
Rogan, supplementary.
Minister, you may be aware in the Downpatrick area of my own constituency of South Down, there's a serious shortage of special school places, and I want to take this opportunity to commend the great work and the leadership of Knockevin Special School. This school is well oversubscribed, indicating that there is a need for increased provision in our area. Will the Minister commit to looking into this to ensure the provision is available for local families in the area so they don't have to travel miles and miles for suitable placement?
And again, there's always a bit of a balance in trying to ensure that the people don't have to travel too far, while ensuring that there's an element of specialist quality. Because if you take within any side of things on it and simply spread that too thinly, then you don't get that level of quality. If there is, for instance, to be either additional provision, certainly in terms of either additional school or units, directly, I suppose, at first instance, it would be for the EA. If it requires a development proposal, then that would be something that as Minister, I would have to sign off on. But certainly, we want to make sure that every provision is made for special educational needs students.
I call Keith Buchanan.
Thank you, Mr. Speaker. Minister, you're obviously aware of the trends in international mathematics and science study, and how to write that down. Tim's recent report into Northern Ireland's position in mathematics. Can you give the House an update on your opinion on that? A good report, and obviously what Northern Ireland did in that?
Certainly, I would welcome that report. It is in dark days that we've had fairly sort of good news. Across the world, I think we've ended up on the Tim's report that's been published today on mathematics, it being the 7th highest performer in the world of those who put in. I think there was around about 58 countries that were in. Of those countries that are wholly within Europe, we actually were the top European country, and that indeed. We significantly outperformed, and I suppose do this on a cross-community basis, we suitably outperformed pupils in both England and the Republic of Ireland in relation to that. There was also, I think, in science a strong performance with about 18 countries being grouped ahead of us, 28 below us. And it should also be remembered that a number of jurisdictions did not participate in TIMSS, possibly with a suspicion that they wouldn't have got the result that they wanted, which makes our position even more impressive. The findings, I think, emphasise that education, particularly for Year 6 pupils in Northern Ireland, have a high academic success. There's very little problems with school discipline. We have very safe and orderly classrooms. It is also the case, I think, this is maybe a lesson as well, that where the most successful countries are the ones with the smallest gap between those of socio-economic advantage and disadvantage. And while, again, there's a good deal of work to be done on this in Northern Ireland, it is noticeable that our figures show that the gap between more affluent and more socially deprived children was considerably lower at both maths and science than it would be for the international comparators of those that were involved in TIMSS. So it shows actually in many ways that there's been a lot of good work, but of course there's a lot of further good work still needed to be done.
About a minute left to call Keith Buchanan supplementary.
Thank you, Mr. Speaker. Thanks, Minister, for your answers so far. Just with regard to, obviously, this year and the difficult year it's been with regard to digital learning and online learning, etc., What's your opinion on the TIMS findings on that learning environment, basically by digital means?
Again, there's been a situation, the TIMS findings again showed that we were considerably ahead of the international comparators. There is issues around, which I know even in the previous ministerial question mark, over ensuring that there's broadband availability, and there's always more that can be done. But what it did show that that 96% of students said they had access to a computer or tablet. That compares, it's much well ahead of what is there. Now, that doesn't necessarily mean they have individual access at home. And I suppose to cover the situation, particularly during lockdown, there's been so far over 10,000 devices have been provided to our most disadvantaged and vulnerable learners. Again, there is further work to be done, but again, on the comparisons that we have, and we can only take this as an independent report, looking at our comparisons with other jurisdictions, we are well ahead of the international average. And I should also indicate that many of the very affluent economies throughout the world were part of TIMS, so this is not, if you like, comparing Northern Ireland with countries always that have levels of difficulty in that regard.
Members' time is up, and members, please take your ease.
If members take their seats, please. We now move to questions to the Assembly Commission. I consider Céad Galchis, Adams and Dr. Kiva Archibald. I call Dr. Kiva Archibald.
Question 1.
And Keith Buchanan is to answer.
Can I thank the member for a question? The Assembly Commission has a strong focus on the health and well-being of staff, and this is a key aspect of both the Commission's corporate strategy and its corporate plan. The Commission also has a health and well-being framework and a wide range of health and well-being resources on the Assembly's intranet. During the period of COVID-19 pandemic, the Commission issued 3 regular weekly communications to keep in touch with staff. As many were working some or all of the time from home, each week, Wellbeing Wednesday, communications were issued to promote a wide range of resources on health and wellbeing topics. The Commission's Employee Assistance Programme continued to be available throughout the pandemic. Under this programme, staff can avail of 24/7 counselling, online training and access to a range of electronic resources covering health and wellbeing topics. The Commission also has 18 staff trained as mental health first aiders, and our learning and development team regularly promotes activities to assist staff with managing their health and wellbeing. The Commission will continue to support and promote the good mental health of its staff throughout the pandemic and beyond.
Kiva Archibald. Supplementary question for Kiva Archibald.
And I thank the member for his answer. It's really welcome to hear those resources. Would the member agree that the Commission has a duty not only to ensure staff are looking after their physical health, but their mental health and well-being as well, especially given the added pressure that many will have faced as a result of the pandemic and the extra workload that they'll have been carrying?
Thank you. Yes, I would agree with you totally that obviously the Commission has a duty of care to members, and indeed just moving on from staff within the building to our own staff as an MLA personally, and whether that be in the building or remotely in your own constituency offices. And just for your own information, I think the member would be interested that we're also there is a service under the tracking and members support on the CAMS office are currently exploring the delivery of electronic courses on mental health awareness through an NICS online training platform. These short training courses will then be available to all members and their staff. So it's not only members in the building, whether they be employees of the Commission, but our own employees directly.
Mayor Cara Hunter von Cast. I call Cara Hunter.
Thank you, Mr Deputy Speaker, and I'd like to thank yourself for being here today to answer questions. My question is, what steps is the Assembly Commission taking to encourage further uptake of the specific mental health support offered by the Commission during the pandemic?
Well, there's obviously some parts that I maybe need to get more written clarity for the member. If you don't mind, I will do that. So through the Commission, if you're happy, that we'll write to you and give you more information.
Question 2.
John O'Dowd, Honfragerha. John O'Dowd to answer.
Can I thank the member for his question? And with your permission, Mr Speaker, or Deputy Speaker, can I ask for an additional minute as I'm going to answer question 2 and 5 together? I thank the members for their questions. As members will be aware, the Speaker, on behalf of the Assembly Commission, announced in July 2020 the establishment of an Assembly-supported Youth Assembly. Since then, work has been underway to put in place the detailed arrangements for the establishment of the Youth Assembly. A number of important developments have occurred, and I will outline some of those for the members. 2 members of staff from the Assembly's Education Service were appointed to take forward the work, and they have been joined by 2 youth participation officers who started work on the 30th of November. The Speaker is establishing an advisory group to give the Commission access to advice, including from the youth sector, as it takes further significant decisions. The group will be advisory as opposed to having decision-making powers. A Young Persons Youth Assembly co-design panel has also been established to help co-design some of the practicalities relating to the Youth Assembly, notably around recruitment and selection, induction and communication. Up to 6 virtual sessions of the co-design panel have been arranged for December. Indeed, one has already taken place. Once all of these sessions have been held, staff will write up the outcomes and findings and bring them back to the panel in January to allow it to finalise its thoughts and recommendations. Work also continues with regards to awareness raising. A Youth Assembly web page and online social media presence have been created. Emails have issued to the youth sector, schools, further and higher education colleges, youth organisations and sporting organisations, and over 640 people have signed up to a Youth Assembly mailing list. Looking ahead, it is hoped that the report of the co-design panel's findings with regard to the recruitment selection will be available for presentation to the Assembly Commission by the end of January. Not surprisingly, the COVID-19 pandemic has had some impact on progress to date and may yet slow the pace of progress. However, as we have said previously, the Assembly Commission is determined that the Youth Assembly will be established and operational as soon as it is possible, and the Speaker has said that he looks forward to hosting the first formal plenary of the Youth Assembly in the Assembly next year, hopefully before the summer.
Jerry Carroll, supplementary for Jerry Carroll.
I thank the member for the detailed reply, and I'll probably forward some Assembly questions on the information that he supplied, but thanks for that. Would the member agree with me that we need to see some legislation to ensure that the Youth Assembly is permanent, a permanent feature, not dependent or subject to the Assembly time or budgets? And would he also agree with me, I know we talked about the advisory group and the co-design panel, would he agree with me we need to ensure that young people set the agenda and the methodology via some form of youth steering panel, and include those young people from the NI Youth Assembly who have lobbied to participate in it already so far? Thanks.
Thank the member for his further questions. The member will be aware, even from the information I've given him, that the Commission is keen to have young people design the Youth Assembly from the outset and to bring back their recommendations, and for the Commission to be directed by young people rather than the Commission directing the young people. In terms of legislation for the future, the Commission will await the recommendations of the various advisory groups that have been set up, and we will move from there.
Call Chris Little.
Thank you, Deputy Speaker. The Alliance Party has supported the campaign to give a voice to our young people throughout my time as an MLA, so I welcome this long overdue progress that has been made on the establishment of a Youth Assembly. Can I ask how members of the Youth Assembly are likely to be appointed, and in what way members of the Youth Assembly will be able to interact with procedures of this Assembly?
Thank you, Member, for his question. Again, these matters are for the panels which are currently sitting and are going to advise the Commission to bring forward. We don't want to set out what's going to happen ahead of the panels having their discussions and making recommendations to the Commission. So this is youth-focused. They're planning it, they're bringing it forward, and the Commission then will roll out the recommendations.
Emma Rogan, I call Emma Rogan.
The member has outlined some of the actions so far which the Commission has taken. What actions is the Commission going to do to ensure that the Youth Assembly is inclusive and representative of our increasing diverse society?
Thank the member for her question. The extent to which the consultation has taken place thus far, I think, shows how the Commission has reached out. Over 640 people have signed up to be contacted in relation to matters in relation to the Youth Assembly. And there's also, in terms of the groups that I listed earlier, following organisations have been invited to nominate to the Youth Assembly's co-design panel: the National Children's Bureau, Boys and Girls Clubs, uniformed organisations, Youth Work Hub, Girl Guiding Officer, Scouts NI, Girls Brigade, Boys Brigade, Cara Friend, Disability Sport NI, Disability Action. So it's quite a broad range of organisations and representative bodies that have been contacted to have input into the design of this.
I call William Humphrey.
Deputy Speaker, in a sense, the Minister has answered part of my question. As someone who declared an interest as a member of the Scout Association, there's a hugely important role in Northern Ireland. The Scouts, BB, GB and Guides. It's important that their role and contribution to society is reflected in this Youth Assembly, which must be reflective and representative of Northern Ireland society. How can we ensure that that actually happens?
As the member said, we have contacted a broad range of uniformed organisations who do play an important role in our society, and even over the most recent period of the COVID pandemic have shown the volunteering spirit of many of our young people. But again, I emphasise, this is down to the design panel. They are meeting, they are discussing, the young people are engaging on what the Youth Assembly will look like. So let's wait on their recommendations and move forward from there.
Mr Deputy Speaker, question 3.
Sir Lors Kelly Hunfregger. I called Lors Kelly to respond.
Thank you, Mr Deputy Speaker, and thank the member for her question. The management of the requirements arising from the Working Time Regulations Northern Ireland 2016 for Assembly staff is addressed in the Assembly Commission Staff Hours at Work policy. The purpose of the Staff Hours at Work policy is to establish a fair, equitable and consistent approach to the management and recording of hours worked across the organisation. The policy advises that staff will normally take and record a lunch break of at least 30 minutes each day. The policy also states that it is important to remember that under the legislation, a break of at least 20 minutes must be taken if staff work more than 6 hours. This break must be taken during the working period and cannot be taken at the start or the end of it. The policy also states the staff must have a break of at least 11 hours between finishing one work day and starting work on the following day. It is the responsibility of all staff and their line managers to ensure that this requirement is met. By way of example, the policy records that if staff work until midnight to cover a late plenary, they should not start work until at least 11 a.m. the following day. Staff record their hours worked, including breaks, during the working day in a personal electronic record, which must be reviewed by their line manager at least monthly. For Assembly staff who work within a shift pattern, the shift rota is developed to comply with the legislative requirements.
Rachel Woods for a supplementary.
I thank the member for her answer, and the member has touched upon it, but the member will be aware that in recent weeks plenary has gone on into the wee hours of the morning, and under the Working Time Regulations, a worker is entitled to a rest period of not less than 11 hours in each 24-hour period during which the worker works for an employer, as you've outlined. So can I ask that the Commission to ensure staff who are here to 3 a.m. are not back in here at 8 or 9 in the morning?
Thank the member for her supplementary, and the member can be assured that both the Assembly Commission and indeed the Business Committee is very mindful when setting the agenda for business on a weekly basis that we do try to comply with a decent finishing time, although of course there are on-time debates, and I know that the Business Committee, the Speaker is bringing forward a paper to look at options that might be available to the Business Committee and to the Commission in terms of the orderly taking of business here, but without constraining the scrutiny and ability of members to ask questions and to outline their responsibilities in relation to legislation. So there's no doubt that late plenary sittings can lead to operational difficulties for a number of business areas within the Secretariat, and heads of business and line management are committed to working with their staff as far as possible to ensure that they have breaks in accordance with legislation and Assembly Commission policy. But given the shortness of this mandate, the legislative programme that is before us, I can assure the member that the Commission and the Business Committee are all very alert to the Working Time Directive.
Sir Gemma Dolan, to call Gemma Dolan.
To ensure staff are getting their breaks and time away from their workstations, does the Commission need to recruit more staff or review work practices?
Thank the member for her supplementary. The Assembly Commission is absolutely committed to the full and effective implementation of all legislative requirements. Any member of staff who does not feel that he or she has received a break as set out in the Working Time Regulation should raise that matter in the first instance with their line manager. However, as the member knows, there has been during suspension there was not a lot of staff redeployed across different business departments, and the Assembly Commission and staff in this building is below the numbers required, and there is an extensive recruitment exercise ongoing at the moment. So we would hope to be in a position to fill all of the posts over the coming months.
Okay, as the member for question number 4 isn't in her position, and question 5 has already been grouped with question number 2, Anish Bugamish Guji Evershay and Ailmus Melissa McHugh for when you cast. Call Melissa McHugh.
To ask just the Commission to outline the criteria used to decide whether Assembly staff are required to work in Parliament buildings or from home during the COVID-19 pandemic.
John Blair to respond.
Deputy Speaker, thank you, and I thank the member for the question. Throughout the pandemic, the Assembly Commission, like other responsible employers and in keeping with all regulations and guidance, has sought to ensure the health and safety of all users of Parliament buildings, including the health and safety of Assembly Commission staff. Specific measures that have been taken include visible guidance relating to the management of risk through effective hand washing, the implementation of social distancing measures, an enhanced cleaning regime through expediting and using a widespread policy of working from home where that is possible. In the early stages of the response to the pandemic, the Commission also was acutely aware of the specific issue of staff who were at increased risk of severe illness from COVID-19 and the need for them to be particularly stringent in following social distancing measures. For that reason, in keeping with the guidance in place at that time, staff with specific underlying medical conditions were not required to travel to work. As with the regulations and guidance have evolved, the underlying criteria that is used to decide upon working in Parliament buildings or at home has remained largely the same. These are, firstly, does the work of the Assembly require the attendance of the member of staff in Parliament buildings? If so, that member of staff will attend Parliament buildings in a safe and secure manner. The situation arises for staff from a range of business areas. If attendance is only necessary on specific days or for part of a week, many business areas have implemented a rota system to ensure coverage of Assembly business while mitigating the risk of COVID-19 infection. If the work of the Assembly does not require attendance at Parliament buildings, that member of staff can work from home if his or her duties are amenable to home working. The Commission will continue to ensure that all services required by the Assembly are delivered while safeguarding the health and safety of staff.
Okay, Starlene Tach, Melissa McHugh. Supplementary question, Melissa McHugh.
Margaret, thank you for your answer. It would appear just during the latest lockdown that a significant number of staff continued to work on site, particularly on the 4th floor. Why was this?
Deputy Speaker, thank the member for the supplementary question. The figures around this would show that from a staffing body of just under 345 full-time equivalent members of staff, the nature of the risks are such that some 290 full-time equivalent members of staff are able to work from home either for all of the time on their own device or on a device provided by the Commission. The actual number of staff who are working from home on a particular day will vary depending on the nature of Assembly business and the need for a physical presence in Parliament buildings. For example, on a Monday and Tuesday, the number of staff working from home will fall, as there is a need for staff to help facilitate plenary business on those days. Similarly, staffing will be needed to facilitate committee meetings on Wednesdays and Thursdays each week. There is less need for staff to be physically present at Parliament buildings on a Friday when there is no plenary or committee business, and hence the number of staff working from home can be greater.
William Humphrey, question.
I thank the member for his answers so far. Last Thursday, the Permanent Secretary of the Department of Finance and the head of Northern Ireland Civil Service HR were in front of the Public Accounts Committee around this very issue. One of the points that a number of members made to them was the fact that those members of staff who are working remotely have to be managed in terms of targets, deadlines and in terms of productivity. Is the Commission absolutely convinced that that's been happening and continues to happen?
Deputy Speaker, thank the member for the question. During the COVID-19 period, the Commission undertook a survey of staff based on wellbeing communications. I think we'll come to this in later questions also. I think the findings of that survey showed that a vast majority of staff felt that they were able to work effectively from home and were trusted to do so.
Okay, as the Mr. Beattie isn't in place for number 7, Inish Bogamish Gigi over Hocht, I move to number 8. I guess Iram Sir Nickel Brogan when you cast. Call Nickel Brogan.
Garmiogat Laskin Corla, Kesh over Hocht, Hall. Question number 8, please.
And Keith Buchanan is to respond.
I thank the member for her question. The function of the Assembly Commission as set out in section 44 of the Northern Ireland Act 1998 is to provide the Assembly or ensure that the Assembly is provided with the property, staff and services required for the Assembly's purposes. Therefore, the working hours for most staff employed by the Assembly Commission will be directly related to the working hours of the Assembly. A notable exception to that requirement is the working hours for staff who maintain a 24-hour security presence here in Parliament buildings. However, for the vast majority of staff, working hours are dictated by the working hours of the Assembly. Those working hours, most notably the duration of sitting times or the scheduling of committee meetings, are not within the gift of the Assembly Commission. Sitting times are the preserve of the Business Committee, and scheduling of committee meetings falls to each committee. However, I am aware that the Speaker has agreed to come back to the Business Committee with a range of options in relation to how business might be better managed with the heavy programme of legislation which is expected towards the end of the mandate. Therefore, while the Commission has no role in setting the working hours of the Assembly, it has a range of policies and procedures in place, including a staff hours at work policy and a flexible working policy that have enabled approximately a quarter of all staff to utilise flexible working patterns to facilitate better family-friendly or care-friendly work patterns.
Nicola Brogan, supplementary question for Nicola Brogan.
While I am very much a newcomer to the Assembly, I'm already aware of debates that have gone on until 2 a.m. in the morning. While the democratic scrutiny of legislation is crucially important, is it not the case that a few members making long, uninspiring and at times repetitive speeches means that there is at times more hot air than scrutiny? The long sittings that result make this legislature a less family-friendly environment for staff and MLAs to work in. In light of such prolonged debates, how does the Commission envisage encouraging all members to be conscious of responsibility to each other and to the staff who support our work here?
Well, thank you very much, and you're more than welcome as a new member, and I welcome you to the Chamber. And indeed, your words, not mine, that some members maybe take the long road round, or as the Speaker previously said, they take the detour. That said, I believe that is brought up and discussed maybe about 2 weeks ago at a Business Committee meeting, which I am a member of. With respect to, we don't want to deter debate or stifle debate, but sometimes some members, and I wouldn't want to dare look anywhere around the Chamber to indicate who, some members may take an extremely long sentence to say a short sentence where it's dude. That said, the Business Committee has discussed this, and the Speaker's way to look at that with regard to controlling debate, because I appreciate whenever you go on to 2, 3 o'clock in the morning, it's not family friendly. There's no way of putting that. So it is on hand through the Business Committee and not the Commission.
Call Pat Catney.
As an ex-employer myself, I just did thanks for your answers so far. When was the last time the Assembly Commission surveyed the staff for their views on their working conditions at the Assembly?
Thank you, the member, for your answer. I'm not actually sure, but I have no doubt my colleagues in the box will take note of that question. Right, if you're more than happy with that answer at the minute, we'll get clarity with the member.
Na siarm sir Orlia Flynn for your cast. I call Orlia Flynn.
May I get the last can call you question number 9, Little.
And I call Glorious Kelly to respond.
Thank you very much, and I thank the member, Mr. Deputy Speaker, for their question. I understand that this is an issue which the Commission has considered on a number of occasions over the years. Progress has proven difficult for a range of reasons, including that it has not been possible to obtain suggestions of items which are available to meet these objectives or indeed to achieve political agreement. Most recently, the Commission considered a request for a permanent display of some of the artefacts owned by Assembly Commission, including some which are currently kept in storage. The Commission was unable to reach consensus on that request, but agreed that officials should explore whether there were artefacts available for loan from other places which would add balance to ensure that any display reflected the entire community. Initial contacts by officials were unsuccessful in identifying potential objects. This work was then paused as a priority was given to re-establishing the Assembly in January of this year and then to managing business in the context of COVID-19. The Commission had a discussion about this issue at its last meeting and agreed that it was an important piece of work, and officials are now currently in discussions with Dr Eamon Phoenix in order to try and identify potential artefacts which might be more reflective of the entire Assembly and be available for loan and which could be added to those owned by the Commission. Assuming that potential items can be identified, then officials intend to develop a range of options for the Commission to consider. Thank you.
Case Dorlintach, Orlia Flynn. A supplementary question for Orlia Flynn.
Yeah, Gormayogat, and I thank the member for her answer. Would the member agree with me that we're now 22 years on after the signing of the Good Friday Agreement, which promised equality and mutual respect? So would the Commission agree that now is the time that they act to ensure that in any displays, paintings, artefacts and symbols throughout this building, that this should reflect and be representative of all the citizens and the diverse society that this Assembly now serves? Gormayogat.
Thank you, Mr. Deputy Speaker, and I thank the member for her supplementary, which touches on a couple of areas, one being a perceived imbalance, and some might say a very real imbalance in terms of the symbolism of this building. And the member will understand there are different views within the Commission on these issues. This building was influenced by the history of the time when it was built, and some might argue that it is less reflective of the current Assembly since 1998, although some of the additions of recent years, including the portraits of former office holders and those of Seamus Heaney and C.S. Lewis, are more representative of the current makeup of our community. It would be misleading if I told the member that I expect it to be easy to take these issues forward in an agreed way, but it's at least positive the Commission has agreed to look at this area further. And if I might add that there was indeed a 14-week public consultation in relation to equality and good relations in this particular context, and the Commission approved the plan in the current 2016 to 2021 Good Relations Action Plan on the 15th of November 2016. The 5-year plan set out how the Commission proposes to fulfil its duty under Section 75 of the Northern Ireland Act 98 in having regard to the desirability of promoting good relations between persons of different religious belief, political opinion or racial group. And the plan contains a number of actions and anticipated outcomes which may relate to your original question of the member, of Ms Flynn, such as the consideration of new art initiatives to allow opportunities to reflect the wider community within Parliament building. Thank you.
Call Jim Allister.
New artefacts are found, will they too be hidden away in storage at a cost of £12,000 a year, or is that only reserved for existing artefacts? And when will the Commission catch up with our history and agree to an exhibition of artefacts which it owns to coincide with the centenary of Northern Ireland?
Deputy Speaker. Well, I think the Commission and many members and political parties are very sensitive to what's called, I think, the decade of centenaries, and we have tried to take a mature and respectful approach to that. I think the Commission has agreed principles for centenary events, which require events to be organised in an inclusive, politically sensitive and respectful way, which takes account of different perspectives. The Commission is due to have further discussion at its next meeting in relation to how the centenaries in 2021 will be marked, and those events will be consistent with the principles and are required to be agreed by consensus.
Call William Humphrey.
Thank the member for her answer so far. Given her response and that the Commission has been unable to reach an agreement on the display of the artefacts and emblems and paintings and whatever that house them in this Parliament, can I ask the member what position has the Commission taken about some of those going out on loan, particularly next year as Northern Ireland celebrates its centenary, which is important to many of us? What's the Commission's position on that?
I thank the member for his supplementary, and I think he does make a valid point. There are obviously different views in the communities, and there will be some for whom the centenary of Northern Ireland is much more important and something to be marked than others. The Commission is meeting tomorrow, and I give an undertaking to have that particular point tabled and an answer to go back to the member directly.
Call Daniel McCrossan. Daniel McCrossan.
Thank you, Deputy Speaker, and I welcome this particular question and thank the member for bringing it and for the member's answers to them. Has the Commission given any consideration to a lasting monument or memorial to the late John Hume as a key architect of these power-sharing institutions?
Mr Deputy Speaker, I will have to answer, of course, as a member of the Commission, but I would fully support as an SDLP member the principle behind Mr McCrossan's ask. It is something which the Commission hasn't considered, but again, the Commission is meeting tomorrow, and no doubt that then can also be tabled. But I can't make any promises because, as we know, it has to be political consensus. Thank you.
And on that note, we conclude this item of business. If members take their ease while we change the top table here and move to the next item of business.
Order. I'd ask those members who are leaving the chamber to please do so. We return now to the Health Protection Amendment Regulations, and the next person that I have on my list to speak is Mr Doug Beattie.
Thank you, Mr Speaker. It's good to come back to this debate once more. I suppose I'm always mindful and conscious when we look back to when this whole pandemic started and how fast-flowing things were and how we had to make decisions extremely quickly, and multiple MLAs were talking about unprecedented times, extraordinary measures that we all had to take, and we had to change the way we did work within this Assembly in order to keep up with that pandemic. And we gave considerable leeway to the executive because of the threat that we faced from COVID. We give the First and Deputy First Minister considerable leeway, and the Education Minister, and the Economy Minister, and the Infrastructure Minister, and the Finance Minister all were given considerable leeway in regards to scrutiny. And therefore, today, I'm happy to give the Justice Minister the same leeway in regards to scrutiny. But I will start by thanking the Justice Minister for coming here today and moving these amendments. And some of these amendments are the amendments that she brought as proposals, as papers to the Executive. And therefore it's right that she's here today moving those amendments. And I wish other ministers would do similar. Those who brought papers to the Executive and then had them somebody else, in this case the Health Minister, move it for them while their colleagues chirped and complained from the sidelines. Because we have a collective responsibility here, and our Health Minister has moved amendments. Our Justice Minister has now moved amendments. Our junior ministers have moved amendments, and the Economy Minister, I believe, sorry, not the Economy, the Communities Minister has also moved amendments. And that's what we have, and that's what we call that collective responsibility. And we all just need to be really mindful of what things were like at the start of this pandemic and what we were like as MLAs trying to keep up with what we were trying to achieve in regards to that. Having thanked the Minister, and it was a genuine thank, I must start by saying that I remain disappointed that the Minister did not, when asked by the Executive, head up the Enforcement and Compliance Working Group. I accept this is not just a justice issue and that it involves health, communities, infrastructure, of course.
First of all, for his thanks, which is very much appreciated. But can I ask on what basis he says that I wouldn't head that up and how he knows whether or not I was asked at Executive? My understanding is that Executive conversations are confidential. This allegation has been made on a number of occasions and is not factually accurate, but I'd be interested to know why the member feels that that is the case.
Well, I thank you, Minister, but I've asked this question on multiple occasions, and I think that's the first time that you have actually said, no, it's not accurate. So if you're saying to me that you were not asked in writing, if you were not asked in person by the Executive to head it up, then I will say
Order.
Sorry.
Could I ask the member to resume his seat? I fear that we are straying from the content of the regulations. I think it's important. Yes, I know someone was having fun, and if I was in your place, I would probably be enjoying a bit of sport too. But I think that we need to try and get back to the content of the regulations rather than the internal operations of the Executive Committee. Mr. Beattie.
And I'll stand to give way if the Minister still wishes.
Of course, if the Speaker permits. But I mean, the member has now made reference to me being written to be asked to do this particular role, which of course, again, is not accurate, but it does beg the question why the member would have access to written communications from the Executive Office to any minister. So I would like some clarification on this, because it is an important point, Mr. Speaker. Whilst it may not be pertinent to this debate, it does go to the very heart of confidentiality of discussions in the Executive Committee.
The Minister has put her comments on the record, and she is right. It is standing practice and convention that the proceedings of the Executive Committee are to be kept private. Mr. Beattie.
Yes, and I hope, Mr. Speaker, that I can just say that, you know, sometimes as an MLA you use a scatter approach. You throw out, were you asked? You throw out, was it an email? You throw out, was it a letter? It was a scatter approach. I threw out a scatter approach. The Minister has answered that scatter approach, and I will accept what the Minister says, as we all should do within this House. Absolutely, give way.
The member for giving way, and I mean, with the Speaker's indulgence, I suppose, given that there has been a lot of interest around this particular subject, and indeed in the Minister's own words about how we've arrived at this situation, it would actually be very good if the Minister would put in record today what the actual position was around all of that, of course.
Well, I'm going to take what the Speaker has said, and I'm not going down that rabbit hole. But it's suffice to say the point that I was making is that, of course, that enforcement is not a justice issue. It does involve health and communities and infrastructure and economy and finance. And enforcing regulations are important. They are a tool. But I'll just say and agree with what Ms Dillon said earlier, and I think repeated by Mr Sheehan, in regards to the enforcement stance, that it shouldn't just be about enforcement. It should be about encouragement. It should be about giving information so people understand what is expected of them and what's not expected of them, in particular in regards to face coverings. And I suppose the police are right to be criticised when they get it wrong, and they're right to be criticised if they are not consistent in their approach. But I don't think it's fair just to criticise the police for the sake of criticising the police, certainly given the fact that when we bring out regulations, they come out quickly, and some of them are not the clearest regulations that you'd want to stick down on paper. So the police are certainly fighting a difficult battle in regards to that. The amendments that we're talking about today are largely redundant because come Friday, many of them will be overhauled. And I'm not really in this place where I want to just keep talking about redundant amendments purely for the sake of throwing an insult to somebody or just having the ability to have a go at somebody. I'm not. I think a good discussion can be had, but they are slightly redundant. I suppose Amendment 4, the wearing of face coverings, does throw up that interesting dilemma, and the Minister did mention it earlier on, and that's in regards to the fine for not wearing a face covering when you should, and that's £200, if paid for within 14 days, it's £100. But then the individual would not be fined again if he was a repeat offender, but could end up in summary dealings. And that's quite a leap from a fine of what could be just £100 to suddenly finding yourself summary dealings or find yourself in court. And we do have some people who are habitual non-mask wearers. And I guess that's something that we need to be aware of. The whole issue about the mentioning of face masks is extremely complex, and I can't remember who it was, and I apologise, but somebody says that we should not stigmatise those people who can't wear face masks because they have a medical condition, and that's absolutely right. We shouldn't, but we certainly should go after those people who can wear face masks and deliberately do not. Because it's important that we all buy into this, because this is a societal issue and we need to be wearing face masks. And I suppose there's an argument for those people who can't wear face masks because they're claustrophobic on them when you wear them over their face, is that instead of wearing a face mask, maybe they could be issued or given visors that would give you at least some protection. There's an argument there, and I think it's a fair discussion. But we certainly can't stigmatise, but we do need to go after those people who are not wearing face masks. And the last point I'll mention is about vaccines. And this is a good news story, and it's really important that we have a positive uptake and that we in this Assembly, every single MLA, leads by example to get people to take this vaccine, because this vaccine is a thing that will take us out of this pandemic. I've seen somebody saying that all MLAs should take it first to make sure it works and there's no adverse effect, and we should all do it publicly, and I would be more than happy to do that. But then they would all start clamouring and complaining, saying MLAs are jumping the vaccine queue, so you can't win. But I suppose the point I make, and again thanking the Minister, of course.
For giving way, and I do share his sentiment in relation to the good news story of a vaccine. But would he also agree with me that it is important that we respect the well-enshrined principle within the United Kingdom that vaccines are not mandatory, because there is those for their own purposes will not want to protect.
Yes, of course, I think that's a given. I don't think anybody is talking about going into a care home and lining up the residents and blindfolding them and sticking a needle into their arms without them knowing it. I think everybody has to be given the choice whether they want to take a vaccine or not. I think the point that I'm making, and your point has been made really, really well, I think that the point that I'm making is that we need to be absolute leaders on this issue and tell people that this is something that will get us out of the pandemic. And if we show any division on this, if we show people who are promoting something completely different, no matter whether it is something that their constituents are concerned about and they are just promoting that issue, then we will have a real problem, because if we don't have an uptake of this vaccine, we are not going to get out of this pandemic, and we're going to live this over and over and over again, and we're going to lose our people. And over 1,000 dead at the minute. Over 1,000. So over 1,000 grieving families. And we can't keep that on. And just in finishing, again, I'll take this opportunity to thank the Minister for moving these amendments, thanking the Minister for challenging my points of view. And I think that's the way it should be done, because tone is important. How we do things here is important. How we talk to each other is important. How we respect each other is incredibly important. But what's mostly important is how we deal with this pandemic. And we all need to focus on that. Thank you, Mr. Speaker.
Thank you. I call Ms Paula Bradshaw.
Thank you, Principal Deputy Speaker. It's great to be speaking on this debate today on such a positive day as the vaccine programme begins to be rolled out. It offers a very clear glimpse of light at the end of the tunnel, though this set of regulations remind us that there's still a lot of road to travel. And before I move on to the body of my speech, it's disappointing that the Chair of the Justice Committee is no longer in the chamber to hear this, because I think there were some points that he made earlier today that were factually incorrect and did not give a good representation of the work that we on the Health Committee are trying to do. These are negative resolutions statutory rules. We are not given the luxury of having full scrutiny of them. We cannot bring forward health professionals. We cannot bring forward a number of stakeholders. We have 21 days to get this whole process through. He mentioned he would like to bring the Chief Constable there. Again, we would like to bring similar people in, but we don't have that. Likewise, he said that he would have liked the Justice Minister to come and present these regulations today, these amendments that are of relevance to the Justice Committee. We have never had the Health Minister there. It is not his job to come and provide us with that level of insight. It is his departmental officials who are responsible for the drafting, and as Colin, the Chair of the Health Committee, said today, sometimes that can be a cross-departmental delegation, but effectively it is the health officials who come forward to it. Yes, go ahead.
I thank the member for giving way, and the risk of probably misrepresenting the chairperson of the Justice Committee. I think what he did say was that the Chief Constable had been before the Justice Committee on previous occasions in relation to the regulations. I think his point of contention was that regarding these specific regulations, that nobody from the Department of Justice was available to brief the Justice Committee.
The point that I made in my intervention earlier was that it would not be up to the Justice Minister to come forward. These are developed and produced by the Department of Health, and that's why they're coming through us as a committee. And as I made the point, I do engage with my MLA colleagues. We're a small team in Alliance. We all have our own portfolios, and so I would engage with them before the Health Committee if there are any issues. But we have to put trust in our executive ministers. They're the ones who are sitting a couple of times a week at present, looking at the current restrictions, looking at what's coming forward going into the future, and we are reliant on them in these very pressing, very particular circumstances of this pandemic to engage themselves with their departmental officials, their special advisors and others to come up with restrictions that are best case scenario, because nothing is perfect around what we're doing to try and fight this pandemic, and everything is done at haste. And so I would prefer, as everybody on the Health Committee, that we had far more time to scrutinise the regulations, but we just don't have it, and that's why we are saying in every one of these debates that we don't think that the information, etc., is good enough. But we are where we are. Today we are debating these regulations that are so far are out of date that some of them may soon be in date again. So exceptionally, I intend simply to run through the actual amendments we're discussing today. Principal Deputy Speaker, you'll be pleased to hear I'm not going to stray too far off it from here, since we are to assume that they generally will be relevant again from Friday. Amendment 13 is a brave attempt at enforcing the distancing required, which has pretty much disappeared from public awareness ever since the Executive Office reopened hospitality in the summer with the announcement that effectively 1 metre would suffice. It is wise to be cautious about this and to reinforce the 2 metre measure across the board. While I agree it is wise from a public health perspective, I would be interested to hear about what discussions were held with the hospitality sector about the viability of reopening with a strict 2 metre requirement. We've heard this morning, any of us who were listening to the Nolan show this morning, one of the restaurants in my constituency has already determined that come Friday they will not be reopening again for the foreseeable future because it is not financially viable, not least given the risk of having to close again anyway if there was a case on the premises to reopen this side of Christmas. Nevertheless, the whole thing does leave us to wonder why the 2 metre requirement was ever abandoned in the first place. Interestingly, also about Amendment 13 is the requirement for 2 metres to be observed in queues, and I must add that it would make sense to wear face coverings in these scenarios as well. A few weeks ago, the weekend before the departmental officials came to the Health Committee, those photos were circulating on social media. I think it was from outside Primark on the Sunday, whenever it was announced the shops were going to close. So people are queuing, and again we saw it in Lisburn at the weekend, people are queuing outside and they're posing great risks to those around them through community transmission. So by definition, if we have a face covering already for entering a venue, I do not see why they would not be asked to wear it to provide extra cover while waiting to enter. The question about this requirement many are posing, however, is how practically enforceable it is. Establishments do not control the area outside the venue in which they operate, and who indeed is specifically required to do that in a queue. I wonder if we should be looking to other authorities, perhaps councils, for other assistance with enforcement, particularly around the busy Christmas periods. And again, we know where the hotspots are, certainly in the city centre and in South Belfast. I would like to commend the sector, nevertheless, for clearly taking seriously the requirements outlined in Amendment 13. In principle, as many have already calculated, this will mean lower footfall, but it will also mean safer custom, and that can only be to everyone's benefit. I would also like to ask the public in general not to wait for enforcement. It is in the interest of us all and of public health that we adhere to the regulations at all times, including in spirit. The more we crowd, the faster the virus spreads and the quicker we potentially are back in absolute lockdown again. Amendment 14 follows on from a suggestion made some time ago that in the same way that premises must display hygiene ratings in Northern Ireland, they must also display improvement notices if they are not set out in a manner as to adequately enforce the regulations. I think this is an excellent idea in theory, and I hope it works equally well in practice. And again, when we ask the officials around this, there's still some way to go in terms of how they can ensure that best practice from one premise can be shared with the next. Amendment 15 is also a clear improvement, requiring contact details for every customer, not just the person who makes the booking or the first one who makes it through the door. This is essential if we are to have any hope of using this information for contact tracing, which is ultimately the objective. The question does remain, however, does this information suffice, and how precisely is it to be used? I do wonder whether it is enough to take down contact numbers and names, and whether we should not be asking for the full address of every customer. My colleague Pam Cameron from the Health Committee as well have raised this, in that this would go some way to ensuring that the 6 people around the table are only from 2 households. Even if we did this, the question arises if we have adequately resourced contact tracing service to make any use of it, while cases are still over 150 per 100,000 population every week, perhaps moving towards 200 by Christmas Day. Put simply, do we have the right information, and what exactly is being done with it so that it can be used to enhance public health and public safety? Moving on then, Amendment 16, which was only debated by the committee last week, is another one which would probably which should probably have been in place a long time ago. I'm fully supportive of raising the fine for non-wearing of face coverings where required, but I remain of the view that the regulations themselves are still too difficult to enforce in practice, essentially because they enable too many exemptions. A recent survey in the United States shows that case rates have halved in areas with mandatory masks, but in fact risen in areas without. Mr Principal Deputy Speaker, I have no hesitation in commending each of these amendments to the House, with my only real quibble being that it should have taken so long to get to this point. The question I would like answered by the Minister at the end of the debate concerns the practical implications of those amendments to make us all safer and more confident about using venues as they reopen over the Christmas period. Thank you.
Mrs Pam Cameron.
Thank you, Mr Principal Deputy Speaker, and you'll be glad to know that I intend to be brief. In relation to the Health Protection Coronavirus Restrictions number 2, Amendment number 13 regulations, it's worth noting once again the huge sacrifice that we have asked of our hospitality trade, those who own and manage premises and their employees. Uncertainty and disruption like never before has placed a huge strain on this trade. I sincerely hope that this reopening in the very near future is one that heralds their new start. I am conscious too, though, Mr Principal Deputy Speaker, that the social distancing element within hospitality can make a business sustainable or unsustainable, and I would ask for clarity around that 2 metre versus 1 metre allowance for the hospitality settings. Moving on to the Health Protection Coronavirus Wearing of Face Coverings, Amendment number 4 regs. Mr Principal Deputy Speaker, this deals with the penalties and enforcement, and it is regrettable that we have to have such provisions. The vast majority of people have taken on board the regulations and adhered to them, but as in life, the minority do not. And it is right, therefore, that we do have a penalty framework that is in place as a last resort. And I certainly welcome the comments from my colleague Paul given around the necessity to take personal responsibility in adhering to all of these regulations, and that includes enforcement for some. Mr Speaker, I want to touch on the relationship with the local councils as referenced in the Health Protection Coronavirus Restrictions number 2, Amendment number 14, and it is worth this House recognising the huge role that local councils have played in the course of this pandemic. Many workers have been on the front line day and daily, and we thank them for that. I think the relationship between the Executive and Councils can be further developed, and the provision in this Amendment 14 is but one term in terms of enforcement and the provision to issue premises improvement notices where premises are in breach of the number 2 regulations. Mr Speaker, the Amendment number 15 regulations is welcome in the flexibility it affords to certain industries, for example close contact services and driving instruction being provided by appointment only, and the requirement for retention of client information for the period of 21 days. The opening hours allowed for unlicensed premises and the opportunity for bars to provide off-sales business and clarity around packaging. And I suppose it is worth mentioning, as my colleague from Health Committee, Paula Bradshaw, has already mentioned, that the contact tracing is very vital going forward. If we're collecting this information and intending to use this information, it's really important that we have the resource and the staffing behind that system to make that powerful and effective. The Health Protection Coronavirus Restrictions number 2, Amendment number 16 regulations is the final regulation for this debate and makes minor corrections to the drafting of the regulations, ensuring that unlicensed premises serving food and drink for consumption on premises, which reopened on the 20th of November, were governed by a rule to restrict numbers of customers to 6 per table from no more than 2 households. And I have raised this in the past, and I would ask the Minister if she can get some clarity around what specific contact details are required in legislation for the premises to retain. I have asked this question before at the Health Committee and was told the legislation does not specify what detail is to be taken and held, and surely it would make sense to require a postal address along with a name and contact telephone number or email, for example, in order to encourage those to abide by the rules and even to actually make people aware of the rules, because we know how often they've changed and it's quite hard even for us to keep up with them, never mind everybody else. So I would like to see some clarity around that detail that is required in legislation. And understanding that, you know, these rules are they're here for a reason. They've been put into law for the protection of health. I think it would be appropriate that this useful information is provided, especially when we expect that enforcement to happen. And enforcement is very, very critical, and we want to see more enforcement where necessary. But it's right too that, you know, we need to concentrate. We can't legislate for every area of life, as we are trying to do, and we can't enforce every area of these rules and regulations, and it really is up to individuals to follow the rules, to make themselves aware of what the rules and guidelines are, and to follow those to protect each other. Mr. Principal Deputy Speaker, it is regrettable that these debates are effectively meaningless as they come to the House long after the horse is bolted, and this frustration has been well aired on many occasions. And no doubt that same frustration will make its appearance at today's debate once again. Mr. Principal Deputy Speaker, it would be wrong. Yes.
Grateful to the member for giving way, and the member will know that that's a point I've made before. And can I just say, in terms of messaging and getting the message out as clear and consistent to the people of Northern Ireland, having these regulations discussed, debated and agreed at the time when they're going to be released is hugely important to that messaging, otherwise it causes confusion.
And to thank the member for his intervention and agree entirely. And we know where we are, and we know what that we've agreed as emergency legislation back at the beginning of this pandemic, and this is the outworking of it, but certainly not where I don't think any of us in this chamber want to be in terms of legislating. But Mr. Principal Deputy Speaker, it would be wrong for me not to mention on this historic day that we are in, that seeing this morning the first woman, originally from Fermanagh, 90-year-old Margaret Keenan, living in Coventry, being the first person to have the COVID vaccine. And I think this is truly a day to celebrate. This is the light at the end of the tunnel that we are seeing today, so I think it's very, very welcome news. We all understand that there's a long way to go in order to protect all those who are most vulnerable to becoming seriously ill or dying from this coronavirus. And we see that reflected in even the numbers reported today of 14 deaths since yesterday. So it is of vital importance that we continue to do our very personal best to keep the transmission of COVID-19 under control until the threat is much, much less. And we need to support our health service and our economy by following those basic steps and minding our hands, face, space. I would like to finish by wishing Mrs. Keenan a very happy 91st birthday for next week, and indeed to thank her for being a wonderful example to us all in using her common sense and her willingness to be the first individual in the UK to have the COVID-19 vaccine. I'll finish there. I support the motion. Thank you, Mr. Speaker.
Thank you. I call Mr. Pat Sheehan.
And I suppose we've been here before. It's a bit like Groundhog Day when these regulations arrive on the floor of the Assembly, and it becomes a bit of a blur sometimes. So if I get a bit confused, Cian Corla, about the regulations I'm talking about, forgive me for meandering a bit off the topic. I'll do my best to focus on the regulations. And I mean, some of the regulations we're dealing with now have already been superseded, but irrespective of what we're dealing with here today, I think we have to look on them all of the regulations we've dealt with, as part of a contract with the population. We ask them to abide by these regulations, and in turn, they expect us to do our best to protect their lives and to ensure our health and social care system doesn't get overwhelmed. So that's the type of contract that we're in. But I want first of all to deal with the issue of scrutiny, because it seems to have been an important theme discussed here today. And the fact is that we haven't been able to provide proper scrutiny or the scrutiny that we would like to provide under normal circumstances. But we don't live in normal circumstances. These type of regulations are rushed. They're made in haste. Sometimes there will be mistakes. Sometimes there's mistakes in drafting, and there are other problems with them, and they arrive late. And to be honest, in my view, it doesn't really matter which committee does the scrutiny, because we're all going to face the same problems. And I know the chair of the Justice Committee this morning, outlined what he would like to do in the circumstances. And as Paula has pointed out, that's just not possible. These arrive into the committee. They have to be dealt with. There's a cut-off date to deal with them, and that's what we do. Certainly.
Would you agree with me that we on the Health Committee have tried to leave party politics out of this pandemic and try to be very collegiate in our approach to these regulations and amendments throughout this whole pandemic?
Absolutely. In fact, thinking back, I can't think of any serious disagreement or row that has taken place in the committee over the regulations. We've had debates and discussions, I suppose, as thorough as are possible under the circumstances, but I can't recall any serious disagreement over them. I have to say, when I was sitting here earlier listening to the Chair of the Justice Committee, I thought that maybe his problem stemmed from relationship difficulties with the Justice Minister rather than anything else. And it's unfortunate he's not in his place here now to discuss that. But if he needs some marriage guidance counselling, I'm happy to offer my services there. But sure, go ahead.
For the record, I don't believe that he's away seeking marriage guidance counsel at the moment, but I actually think he's chairing the Justice Committee.
Sorry, I missed that. But irrespective of what regulations we're dealing with here today, it's important that everyone adheres to all the regulations, and especially today when we have the beginning of the rollout of the vaccination programme. It's light at the end of the tunnel. We're also coming into the teeth of Christmas, and the restrictions have been relaxed. So with those two things, there is a possibility that people will let their guard down. And of course, coming up to Christmas, everyone's more sociable and more friendly and convivial, and that may lead to the lowering of people's guards in all of this. But we have to be sure that that doesn't happen. We have to be sure that we... Sure.
I thank the member for giving way on something which I think is actually one of the most important points that we could be discussing today, which is the relaxation of the restrictions before Christmas, Mr Principal Deputy Speaker. And there will be a desire within the population to get out and celebrate Christmas as much as they can. There's a lot of hope there, but there's also anger and there's frustration within the community. How important do you agree with me that it is vital that at every level of government here, whether that's executive committee chairs and committees, that we are collegiate in our message over this next number of weeks to give that leadership to the public who have not enjoyed the best examples of leadership throughout this pandemic from certain elements at times, but now we can get it right. We have 2 or 3 weeks to Christmas, and it is vital and it is important that we get the message right and we're collegiate to fight this challenge which is still there and will remain to be there for some time.
Absolutely, couldn't disagree with a word of that. And what I was going to say was that the messaging over the next few weeks is absolutely important. It's vital that all of us are on the same page on all of this, because, as I said, I mean, the arrival of the vaccine has raised people's hopes. We're coming into Christmas, and the restrictions have been relaxed. So there is that possibility of people letting their guards down, and we have to guard against that. And, I mean, I'm sure plenty of people here now, maybe before this pandemic arrived, weren't too familiar with who Gabriel Scally was. I think probably everybody here now definitely knows who he is, and he's one of the most preeminent public health doctors on these islands. And of course, he's originally from here, from the north, and he says, by all means, go out and celebrate with your friends and family before Christmas, and go out and mix and do whatever you want to do and socialise. but be prepared to bury some of your family and friends after Christmas. And that's how serious it is. And that's the message I think that we have to get across. If people disregard the restrictions, if they disregard the messaging of social distancing, of washing your hands, wearing a mask and so on, then we're going to be faced with increased transmission, if not before, certainly after Christmas. So that's important. And some of these restrictions relate to the wearing of face coverings or face masks. I'm on record in this chamber of having advocated the wearing of face masks long ago. I was actually very disappointed that the wearing of face masks wasn't introduced earlier than it was. In fact, the Junior Minister Lyons introduced a bit of mirth into the discussion some months back about me raising the issue of face masks when it wasn't part of the regulations that were being introduced on that day. But in countries who have had a culture of wearing face masks, there is a lower transmission rate of the virus. The science is now clear that the wearing of masks does, according to the Chief Scientific Advisor, significantly reduces the transmission of the virus. So it's about... Sure.
I think the member for given way, and I mean, I have no opinion one way or another on that. I mean, I accept what the member is saying. However, I think whenever you get scientists coming out at the start of the pandemic questioning the use, I think that brings in the scepticism of people. Now we're actually trying to change that message to encourage the use. Now, I comply, I carry my mask with me, I use it on every occasion, but I think the confusion comes whenever scientists actually give out a different message at the start of the pandemic and encourage people actually saying not to use them at that stage.
Well, first of all, that may be the case at the start of the pandemic, I don't know, but from very early on in the course of this pandemic, as far back as March, there was scientific evidence emerging about the efficacy of wearing masks and face coverings. And in those countries where they're worn habitually, in places like South Korea, Hong Kong, Taiwan, and so on, the rate of transmission of the virus, and indeed the rate of deaths as a result of this, as a result of COVID-19, are a lot lower than they are here. And there are other reasons for that too, you know, in terms of their contact tracing operation, controls at their ports and airports, and enforcement of isolation, and all of those issues. So I'm not suggesting that face masks on their own are responsible for those lower transmission rates, but they're certainly a significant factor. And as time has gone on over the last number of months, the evidence in support of wearing the masks has certainly increased. And I know, and I've heard a few members saying, you know, well, you have to bear in mind that there are people who can't wear masks. There are medical reasons why people can't wear masks. There's psychological reasons and so on. And I heard a reputable doctor on the TV recently saying there really isn't any reason why anyone should be refusing to wear a mask. There may well be some small number of exceptions, but by and large, everybody should be wearing masks or face coverings, particularly indoors, and particularly when they're coming into contact indoors with other people. So, and my criticism about the fact that we didn't introduce face masks earlier is again because the countries that have been most successful in dealing with this virus are the ones who have acted with speed. They haven't waited for the science to be absolutely 100% sure. If there was any suggestion at all that a measure was going to work, then they moved quickly. When the virus first arrived in South Korea, the government called in all the pharma companies and told them to develop a test. And the pharma companies came back and said they could only they could only develop a test that was 90% accurate. The government told them to go ahead. Better 90% accurate than not carrying out any tests. And the same with these other issues, such as face masks and so on. You know, speed is of the essence. We need to move quick. We can't sit and discuss. And, you know, it's similar to these regulations. We can't thrash them out and introduce them here in the Assembly and debate them until we're blue in the face. We need to move quickly, and in those circumstances, sometimes mistakes are going to be made. But that's what happens in these circumstances. Sure.
I thank the member for giving way. I'm just a little bit concerned with some of his speech talking about face masks and that the majority of people can wear them, because certainly I'm chairing a newly formed group, the all-party group on lung health, and there are very many serious conditions out there which do not, certainly would not be complementary to wearing of masks, whilst I wear my mask on every occasion where I need to and where it's appropriate. I think it is good that we recognise that there are people who absolutely should not be wearing them. It's detrimental to their health, and I also think we can't dismiss some mental health aspects of face coverings as well for those people, even for instance with claustrophobia or severe asthmatics. There are certainly cases where wearing of mask is not appropriate and certainly not good for health. So I think it's important that we do keep it real around this, and not everybody can wear a mask, but all those that should do.
Well, I accept what the member says. I have no difficulty with that, and I'm quoting what a doctor said. You know, there's always an alternative. If you can't wear a face mask, there's probably no reason why you can't wear a visor, for example. And a visor, they say, isn't as good as a face mask, but it's better than not wearing anything at all. And that's the issue that I'm trying to bring forward here. But I think there are also quite a few chancers who say they can't wear a face mask, and they get away with it because they don't have to prove that they can or can't. And I suppose, in terms of, you know, I talked about part of these regulations are part of a contract, and there are issues around enforcement, compliance, support, and in my view, they are all part of the one continuum. I mean, you start off supporting people, you ask them to comply, you do what you can to ensure that they can comply, and that was the reason I raised earlier with the chair of the TEO committee the issue of providing masks free of charge in some circumstances. Maybe people who are on benefits or something like that, the low paid, that masks could be made available to them. So, I mean, it's an important day. This is the day the vaccine rollout has started. And I hope, and I suppose most people will be praying, that the timetable that has been announced will be kept to. And I have to say, without wanting to rain on anybody's parade here, I have some scepticism about the ability to roll this vaccine out in the timescale that has been announced. And there are a number of reasons for that. First of all, we're dependent on this British government to supply this vaccine. And everything this government has touched so far in relation to this pandemic has been shambolic. Every single aspect of the pandemic that they have dealt with, they've made a mess of it. And we are dependent on them to get this vaccine. Sure.
I thank the member for giving way. And Principal Deputy Speaker, would the member not acknowledge the fact, and I know he's been critical of the British government's and Her Majesty's government's approach on COVID thus far, and on some points for very good reason, but would he acknowledge that the very fact that people have been able to access the vaccination today was because of the world-leading scientists that have made the vaccine possible for UK use today?
Well, first of all, I'm not making a political point about this in terms of constitutional issues and where the vaccine's coming from. All I'm saying is the source it's coming from is not reliable. And I'm on record as welcoming the introduction of the vaccine. And I'm also on record as saying, I will be taking the vaccine and I will be encouraging absolutely everyone else to take the vaccine. I said here last week my children would be taking it too. I was a bit quick off the mark there because my understanding is the children won't be getting the vaccine. But in any event, I'd certainly be encouraging as many people as possible to take it. My problem is merely, it's with this particular British government and the way they have dealt with the pandemic so far. And they have exhibited a degree of ineptness that's rare to see in any government. And that's partially my concern. I have other concerns as well. My concern in regard to the contact tracing operation here has been well documented, and there have also been problems with the rollout of the flu jab here. So what I'm hoping is that between the Department of Health and the Executive Office and the COVID-19 task force, between them can ensure that there's a smooth rolling out of this vaccine. And the sooner most of us get the vaccine, the better, and we'll get back to some sort of normality. So, Cion Corla, I think I'll leave it there.
Thank you. I call Mr. Jonathan Buckley.
Thank you, Principal Deputy Speaker. And I suppose in beginning my remarks, I too would want to mark this hugely significant day when the first of the vaccines have been provided to some very vulnerable individuals alongside our healthcare workers. I think that's remarkable. I think it's a day that many of us have looked forward to. It's certainly a day in which general society can start to look towards a day when regulations in this regard are no more, albeit we are far from that position. But it is certainly something that I welcome, and indeed my party welcome, as I'm sure there's a sigh of relief among many people across our society, whether that be from a care home setting, a vulnerable individuals setting, whether that be from our health and professionals setting, you name it. Everyone has an interest here, and I suppose probably we, of all people in this House, know all too well that their hopes and aspirations depend upon a successful vaccine and getting life back to some form of normality. In discussing the regulations in general, true to form, I will point out, as I have done on previous occasions, the folly of the way in which regulations come before this House. Because Principal Deputy Speaker, it has become a case that each time regulations come before this House, some coming to the end of their time, others maybe a week before the end, that they're completely out of keeping and out of pace with where general society is in relation to their content. So it becomes an exercise very much of this House talking to itself. The public switch off because they can't keep at pace with how it's affecting their daily lives. It's something that is always, as members, we need to be acutely aware of because, and I've said this in the Health Committee, we as members of this House, and I exclude executive ministers on this, our primary function is scrutiny. And I feel, throughout this COVID pandemic, and I'm open to hear how other members feel on this point, but I think the point is shared. I feel we have failed the people of Northern Ireland, as I'm sure many governments around the world and many parliaments and democracies have failed their own people in the way in which we have been able to scrutinise this draconian legislation. It has affected every element and infected every element of our society, and yet as legislators, the duty of scrutiny very much has been lost. And I take a look and I think of even the Health Committee, in which I'm now a member of, And in my short time there, albeit now coming on 2 months, I have been disturbed by the lack of democratic scrutiny to these important issues. And I don't for 1 minute actually lay that particularly at the blame at the foot of the Department of Health, but by and large actually how the regulations come before this House. Absolutely, yes.
I'm struggling with the word fail. We've failed. I don't really feel, I feel that the system is very difficult for us to operate in, and the timescales as I outlined as well, but I don't think as a legislator, as somebody who's been elected to represent the people, that I or any of the other Health Committee members, and I know you only joined it, have actually failed people. Could you please explain what you mean by fail?
Thank you, and I thank the member for her intervention, but I will explain what I mean by that. I, by all means, stand firm to say that I think members' endeavours have been true, and their endeavours to best serve their constituents have been put forward in the best manner. But what I mean by that is that we as members have failed in the scrutiny of such important legislation. These restrictions are so draconian that they require thorough, detailed investigation. And by the very means by which they have come before the committee and indeed this House, I feel we have failed our constituents in our ability to scrutinise. Of course.
Well, I do take the point, and we've all said how frustrated we are with the very limited time and the lack of actual witnesses and stuff, but we do it and we support the regulations when they come here, because we know that if we waited another 4 weeks or 6 weeks to do the scrutiny, a lot more people could actually be dead and our hospitals could be even more fuller. And so a lot of this is about balancing risk against us in terms of our role.
I thank the member for her intervention and her point in principle as well on the record, but I cannot distract from how I feel about the way in which this Assembly has been able to scrutinise the regulations that are before us. You know, we've heard earlier from the chair of the Justice Committee, and you know, I know a lot of members can get precious about this point, Mr. Principal Deputy Speaker, that to challenge a department or to challenge a minister is a political handbagging in the middle of a pandemic. I personally do not see it that way. I think members are entitled to the right to ask detailed questions of whatever minister it may be, or whatever. When I finish this point, I will. I feel that members are totally entitled to that point, and I, for one, as a member of the Health Committee, welcome any form of scrutiny. I think it was Mr. Sheehan that said it, from any committee in relation to these regulations, because I do not have all the answers. Members in this very chamber don't. But collectively, we have to scrutinise these regulations and give our constituents the best form of services possible. On that point, I will give way to the Minister.
I thank the member for his generosity in giving way, and I completely agree that there is obviously a need for scrutiny. However, there is also an issue of due process, and would you agree that it may be seen, I think you described it as political handbagging, I'm not going to go that far, but it may be seen as slightly inappropriate to hold someone to account. In my position, for example, where out of an act of generosity I offered to bring this forward in the interest of collegiality, and have found out to my cost that unfortunately no good deed in this place goes without punishment.
I thank the Minister for her intervention. I did note a comment from the Chair of the Justice Committee where he suggested that the Minister led on these very regulations within the Executive. Certainly had a key part to play. So I do feel that, yes, while I recognise when I finish this point, I will. While I recognise the point that the Minister has come before the Assembly to talk about these particular sets of regulations that pertain to her department or her remit, I also want to put on record that I think it is only but right that if the Justice Minister is appearing before the House to talk of such regulations that pertain to her remit, that the committee chair of the Justice Committee has every right to ask on behalf of the members of the committee, as I would expect my own chair of the Health Committee to represent the needs and musts of the own committee in which I sit on, that being health. I'll give way again if the member would like.
I thank the member for giving way. There are two issues that need to be clarified. First of all, there are 5 sets of regulations, only 2 of which my department had any direct input into. We did not lead on any of the regulations, but we worked collaboratively with the Department of Health and their officials in order to produce what are health regulations and remain within the purview of the Health Minister. And on a further issue, it was not the case that we did not give the Justice Committee its place. In fact, we sought advice from the Executive Office Committee as to how to handle this, and we followed exactly the same procedures that have been used with the TEO Committee and any other committee where a different minister led in the House. I'm not standing here today as Minister of Justice reporting on issues to do with the Ministry of Justice and my department. I am standing here today as a member of the Executive, and I am reporting on work that has been done by the Executive collectively.
I thank the Minister for her intervention, and I have no doubt she will be able to articulate her position quite well whenever she responds to the debate at the end. But what I will say is that while she has mentioned that she worked collaboratively, and I did say it in particular reference to 2 of the regulations, I feel that if she did work collaboratively with the Executive, of which I have no doubt, I feel that the Minister will be well able to answer the questions that members may have here in our only form of in-depth scrutiny, if we can call it that we have in this chamber today. I want to look particularly at the enforcement and policing regulation, that being SR 2020-253, an issue that has caused a lot of concern among many general members of the public, because I, for one, do regard enforcement and COVID compliance as a key way in which we can allow business, in which we can allow society to, in some sense, live with COVID. And, you know, Mr. Principal Deputy Speaker, I have been concerned. I've been concerned from the beginning of this process that we were paying mere lip service to enforcement. But that became less clear as time went on throughout this pandemic. And I want to make reference to it because I think it's only but right. And I'm not for 1 minute saying that this is for the Justice Minister to directly answer, but indeed it is for the wider policing question. There is no doubt that for many, COVID 2-tier policing has existed. That is firmly my view. It's the firm view of many within our society as they have watched the police reaction to certain events that have happened throughout this pandemic and their eagerness to enforce in some sense and to dismiss in others. I think of the West Belfast Bobby Story funeral, 5 months on, still no fines, still no action. I think of house parties that have happened in the Holy Lands, limited action has taken place, much to the detriment actually of those residents that have had to live in constant state of panic with house parties continually on their doorstep. And I compare that with the forceful, quick action in relation to the Black Lives Matter protest, to public swimmers in Helens Bay, to gyms, and as Mr Wales quite rightly outlined earlier on in the debate, the action taken in relation to Tandragee Baptist. I have to say, Mr Principal Deputy Speaker, that as the regulation and amendment seeks to increase fines, we must have an equal compliance to policing in relation to the matter of COVID. Public confidence is key to ensuring that there is uniformity of approach in relation to how the public interact and indeed how the police go about their business. And the police confidence at the moment in relation to the way in which they've handled COVID-19 regulations, in my view, has been dire at best. And I don't for 1 minute take away from the fact that it's a very difficult situation to police. But at least do that with an even-handed approach, which will allow for a more collective buy-in from the public. And as we've went through this pandemic, we have looked upon key moments of public discourse which has had a seismic change in how the public have reacted to regulations that have come from this place. And I think particularly of the West Belfast Bobby Story funeral. Because if we examine that particular time and the news coverage in which it received and the sheer sense of underhandedness in relation to how general members of the public were asked to bury loved ones, sometimes on their own, compare that to the funeral of Bobby Storey, there is no doubt that that had a pivotal role in turning many people within society against the regulations that were in place. But I want to say that as we debate and discuss these regulations, I, for one, as a member of the Health Committee, I do welcome the interventions of other committees, and I want to also talk about that of the Communities Committee, because we do have a regulation before us, I think it is number 14, which talks about the powers that district councils will have to rate particular premises to make them COVID compliant or COVID insured. And I think this was a point in which the committee really did try to home in on, but unfortunately the evidence that was forthcoming was lacklustre at best. I, for one, would like to see council leaders being given the opportunity to inform both the Health Committee and indeed maybe even the Communities Committee as to how effective this approach may be. Because in the quick pace in which we're moving, I don't think anybody is under the illusion that the COVID vaccine is going to cease the need for regulations in the short term. But we need to prepare society for what life looks like after January. And I, for one, will continue to argue that COVID compliance, that a level of enforcement, that a vaccination are all part of the puzzle that will allow our society to safely interact, to allow businesses to get on with their day-to-day work and keep our communities safe. But this can only be done if we have attention to detail in relation to scrutiny, and I'm open for any suggestions from members about how we may do that. We've had plenty of debate about the dissatisfaction in the way in which the regulations come before the House, but we have had relatively little debate as to the form of scrutiny role that other committees can play. The Health Committee has a huge agenda. Its workload is immense. I recognise that as coming on to the committee, and I pay tribute to the members of the Health Committee that have been there throughout this entire pandemic. But what I will say is that while we now debate issues of importance such as a vaccine programme and continue to deliberate upon the COVID response via the Minister and CMO, the level of questioning that we can give that particular subject has been so strained. In some cases, members only being given the opportunity for 1 minute of questioning. When you compare that to the body of work which must be involved in the scrutiny of these regulations, I think it is only but right and fitting that other committees be given the opportunity to play their part. On that point, Mr. Principal Deputy Speaker, I do welcome this day for what it is with the vaccination, and I do hope and pray that we can all have a safe Christmas with our loved ones, but indeed mindful of the effects that COVID still has on the wider community. Thank you.
Thank you. I call Ms Orlea Flynn.
And I would like to start my remarks today by acknowledging that the past few months have been really difficult and challenging, and I am genuinely struggling to think of anyone who has had an enjoyable time throughout the period of the restrictions. But I'm aware, and I'm sure we're all aware, of the many people who have had a very stressful and a very lonely time. We've tragically seen the daily reported deaths rise above 1,000, and that true number is likely to be much higher. And my thoughts are with all those families who have been bereaved and who are particularly going to struggle over this Christmas period. As we debate and discuss the restrictions brought forward by the Minister of Health and his colleagues in the Executive, it is important that we don't lose sight of the impact, the negative impact that COVID-19 is having right across society. And in terms of these regulations, we have 4 health protection regulations, amendments number 13, 14, 15 and 16, and we also have an amendment number 4 on the face coverings. and most of the statutory rules did come before the Health Committee on the 26th of November, with the last one appearing on the order paper before the Health Committee had fully considered it, as this was just included on our table papers just last Wednesday. So I think this speaks to the speed at which some of these regulations are being drafted, but also to the importance of having an agreed approach based on public health principles ahead of time. It has to be said that the majority of these restrictions were made around the 13th of November, and as referenced by the Chair of the Executive Committee earlier, I think for many people they will remember that date, more so for the difficulty in securing an agreement in the Executive, including the fact that public health proposals were rejected by some ministers in the Executive. But regrettably, it has to be said that, as we all know, coronavirus doesn't care for political divisions or disagreements. It just wants to spread, and systems need to be in place to reduce or to stop that spread. So I too look forward to the new COVID strategy that was debated and supported by a motion in this House recently and supported by all parties. And just returning directly to the amendments on the issue of enforcement, Amendment 14 essentially designated district councils with the ability to enforce some of the existing regulations. It was made on the 13th of November, some 8 months after the pandemic really started to hit. I welcome that this is now the case, but should it really have taken so long for the Department of Health or the Health Minister to empower the councils? On the numbers of fines being raised, namely the face covering regulations, it's raised the fixed penalty amount from £60 to £200. And it's important to note that when we introduce fines, there needs to be a measure as to their effectiveness. So unless someone has the means to pay a fine of £200, that can just become just as unaffordable as a fine of £2,000. And I make that point because there needs to be a balance struck between introducing restrictions and ensuring that people actually have the means to adhere to those restrictions. That must be the central approach. As much as restrictions are there to control, there needs to be an approach of support. And at the start I mentioned that we've all came across many people who's had a really stressful time, and we know that it includes everyone right across society, the businesses and staff who are struggling with their livelihoods, the health and social care workers, and just ordinary families and people of all ages, no matter what age, young or old. And so I therefore will end my comments with the same sentiments that was made by the Minister in her closing comments, with the tried and tested response to help keep one another safe, just to encourage people to please keep socially distancing, keep washing your hands and keep wearing a mask. Gar miagah.
Thank you. I call Ms. Cara Hunter.
Thank you, Mr. Principal Deputy Speaker, and I'll try and be brief. I welcome the opportunity today to speak on this motion of health protection regulations. Mr. Speaker, we are now moving into our 10th month living with restrictions as a result of the COVID-19 pandemic. Little did any of us think back in March that we'd be here nearly as we celebrate Christmas, that we would be living still with these restrictions. Of course, we all recognise that these regulations debated here today are unfortunately necessary in order to drive down the infection rate of COVID-19 cases here in the north. At the same time, however, we also recognise the many hardships that have come about as a result of the pandemic and the restrictions, not least the damage to businesses. When referring to the Amendment 13, we understand the frustrations and challenges and difficulties new requirements can cause, especially in relation to social distancing and surrounding larger gatherings in smaller restaurants across the north. I know, speaking with businesses within my own constituency of East Derry, that no type of business has not been affected, whether it be in the hospitality sector, contact services including hairdressers, local gyms run by young families, the personal training industry and many other small local shops, which, if not directly required to close as a result of the restrictions, have suffered greatly from a lack of footfall in villages and town centres. We would urge local business owners to continue to act responsibly, to avoid a notice from their local council and prevent any behaviour that may create a serious and imminent threat to public health. December would usually see sectors and businesses experience a boom in business in the lead up to Christmas. Sadly, we all know that this is not the case this year. This must make what has been a very daunting and uncertain year for business owners even more concerning and worrying for their future viability. As my party's mental health spokesperson, I also continue to be mindful of the emotional well-being and mental health impact which the pandemic has had, resulting in isolation experienced by many people. Whilst Christmas is often a very difficult time, and particularly for the most vulnerable in our community, including the elderly, this year presents even more difficulties for even more people. Many family members will not be able to come home for Christmas or gather together. Mr. Principal Deputy Speaker, as I have already acknowledged, these restrictions are both hard and difficult, but unfortunately necessary. We recognise in one of the amendments, number 4, that there is the want to increase fines for face coverings from £60 to £200. We know that fines aren't ideal. No one wants a fine, especially in the mouth of Christmas. So we would proactively encourage the public to continue to do the responsible thing and to wear masks indoors. And whilst this Friday sees us move into another phase of restrictions, I would continue to urge everyone to adhere to the regulations, including practising social distancing in the days and weeks ahead, including over the Christmas holidays, when it would be all too easy to let our guards down. Whilst acknowledging all the difficulties of this year, whether it be jobs, businesses, the restrictions of our daily way of life and mental health and well-being that this pandemic has presented to all of us, the recent news of the vaccine and its rollout now in the coming weeks and months gives us the hope that 2021 will be a much better year. We support the motion before us.
Mr. Alan Chambers.
Thank you, Mr. Principal Deputy Speaker. I hadn't intended to speak in this debate, and I will be brief, Mr. Principal Deputy Speaker. Really, I want to refer to some remarks that my colleague, Mr. Buckley, made earlier in the debate, and he did refer to the perception of two-tier policing, and I would agree with him in that there does seem to be some grounds for people having that perception, and I saw it in my own constituency just recently where swimmers were cleared off the beach at Helens Bay, and law-abiding people, and couldn't understand why they had to leave the beach. But all the talk here about and the dissatisfaction, and it's been well rehearsed in this House, it's been well rehearsed at the committees, and we all are not entirely satisfied with the way regulations have been brought through the system. And in normal circumstances, we wouldn't give some of these regulations, nor the way that they're brought to us, we wouldn't give them house room. But unfortunately, we are in the middle of a pandemic. People are dying. Over 1,000 people have died because of this pandemic. All over the world, hundreds of thousands of people have died. So I think most of us get it, that we are in the midst of an emergency. But some people still seem to be struggling to come to terms with that, and they want everything done just the right way, all the T's crossed, all the I's dotted. But unfortunately, in the middle of a situation like this, people are doing the best that they can to protect life and limb. And in fact, these regulations that have been coming through the last lot of months, we will never know the number, but there are people out there alive today because of those regulations. So we'll have to take that into consideration. And the other most important thing about these regulations, and Mrs. Bradshaw alluded to it earlier, delay costs lives. If you hold back for another 3 weeks introducing something that you think is absolutely necessary to protect the health of the population of Northern Ireland, you are inevitably going to cost lives, and you're going to put more pressure on the NHS. And Mr Buckley used the word fail. We'd failed. But we have to be careful. We have to be careful when we use words like that people who are absolutely knocking their pan in, for the want of a better expression, in the NHS to save lives. We have to be very careful that those people don't feel that somehow we're referring to them. We have to be careful that people in the social care sector who are going the extra mile for people that are shielding, for instance, we have to be careful as well that we don't taint them with the word failure. And the public have played their part. The public really have played their part in protecting life and limb, and by making sacrifices. Not a family in this country that haven't made major sacrifices to comply with regulations. And our children have lost out with their education. They're all back at school, but it's not normal. They're not getting a normal education, and that's not the fault of the teachers or anybody else. It's the pandemic that has created that set of circumstances. And here we are, just 10 months after the pandemic decided to visit these shores, and we've turned around, we've produced a vaccine, which has started to be rolled out today. I'm struggling, Mr. Principal Deputy Speaker, to see where the failure is. But there are people out there who have been waiting for months on grants that they were promised, and they still haven't received them. So maybe a bit of failure there, but maybe we need to look and see where that failure occurred. Now, I know that Mr. Buckley does, and he has expressed a passion for scrutiny. And I think it's a passion that we could all share in this House, that passion for scrutiny. But before I sit down, can I just say, Mr. Principal Speaker, if some of his colleagues in the DUP had exercised a level of scrutiny during the RHI debacle and during the run-up to Brexit, we may not have found ourselves in those situations. Thank you very much, Mr. Principal Deputy Speaker.
Right, two things. Firstly, let's not bark up and down the bench at each other. And secondly, the member knows that the last element of that speech was way beyond the regulations under consideration. But it's on the Hansard, and you've got your views on the record. Mr. Jerry Carroll.
Thank you, Mr. Deputy Speaker. Before I speak on the amendments in front of us, Mr. Deputy Speaker, I want to reiterate the point that I've continually made, that it is astounding that we haven't had a chance to discuss the latest ramifications of the latest amendments that will come into effect later this week, which will see a further opening up of the economy and society once again. It's absurd that we aren't discussing these as they come in. Medical experts such as Gabriel Scally, as has been referred to already, have already warned about a new wave off the back of these changes, and the executive still seemingly doesn't seem that it's right, or think that they or their medical advice merit serious discussion in advance of making or the decision coming into effect. Instead, we're discussing amendments, Mr. Deputy Speaker, as has been referred to, that were laid almost a month ago, true to form once again, from Stormont, delayed, scrutiny and accountability. Given the concerns raised about the latest amendments, Mr. Deputy Speaker, and the Christmas break, I would ask when we are to discuss these new regulations. Will it be in the middle of January, when they have been in operation for weeks, probably almost a month, and the effects will likely already be felt, including potentially another spike in cases? Really absurd beyond belief. Turning to the amendments in front of us today, Amendment 14, Mr. Deputy Speaker, provides Council the powers to ensure premises do have improvement notices, and allows for an enforcement officer from the councils to take action where appropriate. And my concern about this that I raised on the committee is whether councils will have enough staff that are able to carry out this role and function. It seems to me to be a mammoth task. and we are likely to see breaches happening across the board. And to my knowledge, although happy to be corrected, to my knowledge there hasn't been an aggressive, massive recruitment campaign across councils to increase the number of staff who can deal with these issues. And I would be grateful if the Minister could provide some detail about this and how equipped she or her department believes councils are to deal with this, the issue of inspections and notices at workplaces and possible breaches as well. Amendment number 4, Mr Deputy Speaker, relates to face coverings, including increasing the level of fines for people not wearing masks. It should go without saying, Mr Deputy Speaker, that the wearing of face masks is vital and an essential part of the process to stop the virus spreading. However, we have to say that that message has been stymied by the approach of the Executive and occasionally their party members. The Education Minister, for example, rubbished the idea of pupils wearing masks, face masks on buses just a few months ago, then went on to recently accede and accept that demand and that call. Sure will, yeah.
The member for giving way on that point in relation to face masks. Mr Allister, Principal Deputy Speaker, at an earlier point in the debate made reference to the fact that for many of the regulation there has been no impact assessment as to the intended or unintended consequences of these regulations given the speed that they've come. But would the member accept that there is equally the evidence to suggest that proper use of face masks is essential because improper use might increase the risk of transmission? And that comes from the CDC in the United States regarding the many people across the country that are not wearing masks in the correct manner and therefore maybe potentially putting at risk themselves and those around them.
Member for intervention. I don't know what improper use of face mask is, if you can define it. But I mean, the Education Minister, like I said, categorically rubbished the idea that face masks should be worn for pupils on public transport. And I think his point about impact assessments, I'll come on to in a second. Just to add on top of the Education Minister, it was before the Executive, seemingly prompted by the Tories, made it compulsory to wear face masks in shopping environments. Myself and others, Mr Deputy Speaker, including health experts, have been calling for actions to be implemented on this for weeks at the very start of the pandemic. And still, Mr Deputy Speaker, the Executive has not rolled out a programme of the mass availability of free reusable masks, despite myself going on about it for months and other members obviously today and on the committee. So if someone, Mr Deputy Speaker, genuinely forgets to bring a mask while they go on public transport or enter a shop, where is the support provided to them? Not only will they be fined if this regulation goes ahead, these amendments go ahead, but the fine would increase. They would be paying even more. And this is, of course, not to mention as well, which is connected to this issue, the nefarious and dangerous role played by MPs linked to this Executive, such as Sammy Wilson, who repeatedly openly breached the regulations and defied any sense of sympathy with people who have lost sympathy with people who have lost loved ones from COVID. And this is where we get to the heart of the problem of this regulation, Mr Deputy Speaker, in relation to face masks. Because essentially what it does is to blame individuals when it is clear that the public have gone over and beyond to stop the spread of the virus against misinformation and bad examples from those at the top of society. Stronger fines is not the answer here. A better public campaign and better public reps is. And while I'm on the topic, I would ask the Justice Minister, and might fall outside her remit, but does she know whether Sammy Wilson has been fined yet? His efforts were blatant and purposeful, but I haven't heard anything of him being fined or punished yet. These amendments, on the other hand, Mr Deputy Speaker, could see people who have simply forgotten their masks fined. And such hypocrisy will not be lost on the vast majority of people. I will give way, yeah.
On that specific point, Mr Principal Deputy Speaker, I would want to reassure the member that someone who has merely forgotten their mask would not be fined, because this has to be looked at in the context of the police approach, which is to engage, educate and encourage, and enforcement is the fourth of the four E's, so they wouldn't automatically move to fine someone for not having a face covering.
Thank you, but as I understand, there's no detail in the regulation spelling that out. I'll look away, yeah.
It's an interesting issue about forgetting face masks, because the principal of the school that my two kids attend had asked parents when they're leaving children to school to wear a face mask, especially with the younger ones in Rangahay and Rangadow, Primary 1, Primary 2, when they're being brought right up to the door. And I usually do wear a mask, and this morning I was almost at the door and realised I hadn't my mask on, and there was nobody queuing in front of me, so I went ahead. But the point is about someone maybe getting on a bus forgetting their mask. It's not just a question of the forgetting the mask, and the fine and so on is really irrelevant, or enforcement is irrelevant. The point is somebody's getting on the bus. They may be asymptomatic. They may have COVID-19. I mean, I've talked earlier about providing masks free of charge. I mean, maybe the bus driver, if he had a supply or she had a supply, could provide a mask to the person who has genuinely forgotten their mask. You know, so again, I'm raising the issue of making masks free in some circumstances.
Thanks to the member for his intervention, and I agree with that. And like I said, it hasn't been provided for in a mass way. The wide availability of reusable masks, which can be quite expensive for people, and I'll come on that in a second. And I think it is worth hammering home again. I'm happy to be corrected if the minister can. If someone forgets or doesn't have access to a face mask, was they can't afford it, a new pack, or they don't have access to a pack of disposable ones, rather than implementing the measures to ensure that people have every single opportunity to get a mask, as Mr Sheehan kind of alluded to. The Executive is pushing forward with a strategy of increasing fines instead. And I'm happy to be corrected, but I don't know where in the regulation specifies there will be exemptions in specific cases. And my fear is that the way these issues have been proceeded with over the last few months, that people will be fined, and there will be an increase in fine as well. So, for example, can we really rule out a mother rushing out of the house to do her Christmas shopping, and in the rush to get the kids ready and out the door, if she forgets her mask or masks, she will be hit with a fine, and not only a fine but an increased one under this proposal, which will go up to £100 or £200. So I think that's important stuff. And how can we rule this out with this regulation, this amendment being put forward? And if this wasn't bad enough, Mr. Speaker, Mr. Deputy Speaker, when this amendment was presented to the Health Committee last week, we were told effectively that the rate of non-compliance hadn't markedly increased or shot up. So where is the rationale? And hopefully the Minister can come back on this. Where is the rationale? Where is the research, the evidence to suggest or to back up the increasing of fines, to increase the threshold of fines? Where is the assessment of how this proposal would affect people on low wages, on benefits? And that speaks to Mr Buckley's point as well about an impact assessment, or even increase people's compliance with the need to wear a mask. So much like I'm predicting, Mr Deputy Speaker, on other issues, I will probably not be able or likely to divide the House on this question due to the way Stormont is structured and how it doesn't allow for smaller parties to register their opposition in terms of a vote against specific measures. So I want to categorically place on record my and my party's opposition to the ill-thought-out amendment to increase fines for those not wearing face masks in a situation that the Executive has not went over and beyond to ensure people are supported at every step of the way to ensure they do have an access to a mask. Thank you.
Thank you. And no other member has indicated to me that they wish to speak. I therefore call upon the Minister for Justice, Mrs Naomi Long, to conclude and wind up the debate on all 5 motions. Mrs Long.
Thank you, Mr Speaker, and I think this has been a very useful and mainly constructive debate this afternoon. I'm grateful to members for their contributions to the debate. I appreciate the degree of goodwill that the Assembly shows towards what is a very unusual process, whereby the role of legislative scrutiny is applied after the event rather than before. Nevertheless, I believe it is important that this scrutiny takes place in order to examine and comment upon measures that have been taken and to inform how we go forward. In the current context, things move fast, and the observations and concerns of Assembly members are taken on board as we develop policy and work on the next set of amendments. However, it remains the case that it is important the public have confidence that the Executive is not acting without scrutiny. In beginning so, I want to turn my attention, therefore, to the comments of Mr Paul Given. Mr Speaker, as I said earlier, it would appear that no good deed will go unpunished. And unfortunately, it seems that by stepping into this role, I have created somewhat of a controversy in offering to help the Health Minister, who I believe has been in this chamber almost every day since this pandemic began, on almost every sitting occasion. And therefore, I felt that it was appropriate, given that my own department had had some involvement, though was not in control of these regulations, that I would offer to help. And of course, then the Health Department did as I would have done myself and asked me to take forward some additional and rather unexpected changes, which I'm more than happy to do in the spirit of collegiality. With respect to the issue of lack of opportunity for the Justice Committee to scrutinise the regulations, as I said in my opening comments, these are Department of Health regulations made by the Minister of Health. I was asked to lead a short, sharp review on behalf of the Executive in support of the Minister of Health. The review was not a Department of Justice review, and I do not believe it is right to characterise enforcement as being solely a justice issue either. My officials worked collaboratively on the review with their counterparts in the Department of Health, the Executive Office, the Department for the Economy and the Department for Communities. The first stage of the review, a comparative analysis of the offences and penalties in place across the UK and in the Republic of Ireland, was completed by the Department of Health. After which my department developed proposals, given that we have an advisory role only on the creation of new offences and penalties in relation to other committees and departments' responsibilities. We sought clarity from the Executive Office on the Assembly procedures that should be followed, and it was confirmed that policy responsibility for the regulations lie with the Department of Health, and the role of scrutiny therefore falls to the Health Committee, with the Justice Committee requiring notification only. As a matter of professional courtesy, however, the Justice Committee were notified in a letter by me, and a copy of the regulations made available to them on the 1st of December. All of these regulations failed to be scrutinised by the Committee for Health. We were asked by the Department of Health to make an official available to join for the committee meeting at which these regulations were being considered, and we agreed to this. The Department for Communities also fielded an official who had assisted with the number 14 regulations. There was no requirement or expectation that either department should have to notify their respective committee, or that their respective committee scrutiny functions would be engaged by doing so. I believe that such collaborative working across departments is to be encouraged, not criticised or impeded. I'm in the chamber today in that spirit of collaborative working and in recognition of the extreme demands that have been and are continuing to be placed on the Health Minister and on his officials, and indeed on the Executive Office. I have always said that my department and I will play our full part to support efforts to keep us all safe during this pandemic, and that is what we are doing today. In respect of his concerns in relation to policing of the regulations, the Chair of the Committee rightly noted that I would not be drawn into a debate about operational matters, which are the responsibility of the Chief Constable. However, he is incorrect in suggesting that this is something which I introduced when I came into office. It is a convention which has been in place since justice was devolved, as the legal position in this regard is clear. The Chief Constable is responsible for operational decisions and is directly accountable to the Northern Ireland Policing Board. Complaints about such decisions are the purview of the Ombudsman's Office. I am both bound and determined to respect the operational independence of each of those structures as my office and position demands. Moving on to the Chair of the Health Committee, he expressed his concern that these issues and the scrutiny process used around these restrictions are, I think, quite complex and frustrating for a number of members. And I have some sympathy in that regard, a point reinforced, I believe, by Mr Colin McGrath and also by Mr Paul Given. The confirmatory approval process has been put in place to reflect the urgency with which the Executive has had to operate in these extraordinary circumstances, a point I think well made by Mr Chambers in his contribution and by Paula Bradshaw in hers. The normal Assembly scrutiny has been adjusted in order to accommodate the making of regulations in short order, to reflect the requirements of the changing context in which the Executive is working in response to COVID-19. Debates are held at the earliest opportunity available to the Department. The Assembly approved the confirmatory approval process for these emergency regulations, and therefore, with respect, we are following the approach that the Assembly itself has agreed. Whilst it is undoubtedly a frustrating approach, it is nevertheless the appropriate means by which we bring these issues forward. The timing of the debate is also a matter for the Assembly, given the Assembly's own requirements for the input of the Examiner of Statutory Rules and the timing of scrutiny by the Health Committee, which has to be allowed and given its space. The confirmatory approval process allows the Department of Health to make and then lay the regulations quickly. In practice, this has often been in a matter of days or even hours after an executive decision. As a number of members, including Ms Paula Bradshaw, has said, that any delay to making those regulations could cost lives, and therefore being speedy in how we deal with these things is a trade-off against the normal scrutiny that we would enjoy in this House. And I believe that the scrutiny function that our committees and our Assembly provide in this matter are absolutely critical, and we would not have been taking this forward in the way we have were it not absolutely necessary. Normally, the regulations are then scheduled for debate at the first opportunity after the Health Committee session. Given some regulations, however, are only in place for a fortnight, this means that some will be debated after they have ceased to have effect, and I completely understand the frustration of members in that regard. Following the making of regulations, the timing of the scrutiny and debate is largely in the hands of the Assembly. It is worth noting, however, that the process of developing and scrutinising regulations would normally take a matter of months and not days. We therefore cannot follow the normal procedures in these circumstances. And these are not normal circumstances, nor would I or anyone in the Executive or in this House argue that this current procedure is a model for scrutiny in normal times. With respect to the issues raised by the Chair in relation to my issues raised with my officials in respect to the human rights assessment, in regard to the regulations. This matter was raised with the Executive Office following the committee session, and we are awaiting their response in that regard. However, on the wider issue of the queries, my officials are also awaiting a response from the Health Department's Assembly Liaison Officer in order to ascertain the process for responding to the committee. Normally, with the Department of Justice, we would receive a letter from the committee clerk and we would respond in writing to that. And when we receive such a letter, or indeed an alternative mechanism, we will, of course, endeavour to respond. With respect to the consideration of human rights implications, I'm not at liberty to share the exact content of papers presented to the Executive, including legal advice that is provided. However, there is an established convention, as you will be aware, that this type of information is not shared. I can, however, say that the Executive considers a range of factors when discussing potential restrictions and sanctions, including human rights considerations. In particular, we give due attention to whether any measures we are contemplating are necessary and proportionate. As part of the review of offences and penalties, we look carefully at the level of penalties that are applied across these islands and for other offences that would also be dealt with by a fixed penalty. There will always be a careful balance to be struck between keeping people safe and people's individual freedoms. We have heard much about the balance between life and livelihood. But there is a third angle to this, and I think Jerry Carroll made a reference to this. There is life, livelihood, but also liberty. And we need to keep all three of those in mind as we make the decisions and take this forward. And we should not give up our freedoms as a society easily or lightly. We should question when those freedoms are constricted. But that doesn't mean that where it is sensible, we should resist the cooperative kind of efforts that we have been making in order to protect life. So we do keep our balance under careful review whenever we seek to recalibrate our approach to restrictions and the penalties that are associated with them. Following the making, just to return then to track and trace, I think that was another issue that was raised by the Health Chair. There is already, as he will be aware, a developed programme of test, track, trace, isolate and support. And indeed there is support available for those who have to self-isolate through the Department for Communities. However, it would be more appropriate, I believe, for the Health Minister to make any announcements in respect of how he will approach the motion that was debated in the Chamber and passed with all party support. I can, however, say that there is a COVID task force being headed up by the interim head of civil service, though the scope of that is to be further clarified, and that has been agreed by all of the executive. Our hope is that that will bring a strategic focus, not only to the cross-executive approach to tackling the pandemic itself, but also to our plans for recovery, which are hugely important at this juncture. Mr Beattie, yes.
Thank the Minister for giving way. Could you maybe provide clarity in relation to the task force, whether the enforcement element will be included in that piece of work?
There will be a number of elements included in that piece of work. One of the key things, and I'm going to come on to enforcement so the member may get his answer there, but one of the key issues of the task force is not to duplicate structures that are already in place to deliver on executive priorities, but to streamline and coordinate cooperation so that it is a more effective and more efficient system that we use. So it is unclear whether those will be rolled into the task force or whether the current compliance group will continue in its operations and simply work through the task force in terms of coordination. Mr Beattie and Mr Clark showed extreme curiosity as to how the issue of COVID regulations would be enforced and as to whether or not I should be the person who does it, and so I wouldn't want obviously to disappoint them with not providing them with a fulsome response. I will of course not open up executive confidentiality, but suffice to say, Mr Principal Deputy Speaker, I have always been clear that promoting adherence to the COVID restrictions is a cross-cutting matter. Enforcement of COVID restrictions is not solely a matter for the PSNI. Other statutory organisations such as local councils, Border Force and others have responsibilities for compliance and enforcement. Those organisations are not within my purview. The focus therefore should be encouraging adherence, compliance and enforcement, and using as a last resort enforcement only when necessary. The Executive agreed after discussion to set up a strategic level group chaired by the junior ministers under the auspices of TEO to coordinate efforts on compliance and enforcement. Senior officials from my department, from the PSNI and from other departments that are engaged are part of that group and playing their full part in supporting a collective effort to encourage adherence and compliance. The issue of enforcement was raised by quite a number of members, including Mr Buckley. And I want to set out in some detail the issue of enforcement because it does touch on the particular regulations today. Enforcement activity should always be proportionate and must be seen as legitimate. None of us, I believe, in this chamber or anywhere else want to see a heavy-handed response to these issues. Neither is enforcement of COVID restrictions solely a matter for the PSNI. As I've said, other statutory organisations such as councils also have responsibilities for compliance and enforcement. Locally, both the Northern Ireland Policing Board and the Office of the Police Ombudsman have been overseeing enforcement approach by the PSNI and will be reporting on that. Operational decisions, including the issue of penalties, are a matter for the Chief Constable and he is accountable to the Northern Ireland Policing Board. However, the PSNI publishes weekly statistics on the numbers of penalties issued and this reflects their ongoing enforcement efforts. I would encourage members to look at those figures and inform themselves of the work of the police before they comment on these matters, because I think some members would find it surprising. As of the 7th of December, the PSNI had carried out a total of 5,365 actions associated with enforcement of restrictions. PSNI figures, as I say, are available, but I will just read into the record, if I may, Mr Speaker. 2,101 COVID-1 notices, that's penalty notices, were handed out since March. 791 COVID-2 notices, that's 135 commercial and 656 private notices. Those are prohibition notices issued to licensed premises or for restriction of gatherings in a private dwelling. 49 COVID-3 notices have been issued, which are for failure to isolate. 923 COVID-4 notices, That is the one that replaces now the COVID-1 notices, with fines starting at £200 instead of £60. 25 COVID-5 notices. Those are penalty notices issued to businesses and or premises for breach of the regulations, starting at £1,000 to a maximum of £10,000. And 1,476 community resolution notices have been issued. Local councils, in addition, have collectively carried out 58,501 acts associated with public health restrictions for the period 1st of May to the 30th of November. I don't think any member having sight of those figures could suggest that no effort has been made on enforcement. Mr Buckley further raised the issue of the Holy Lands area, which we all realise presented particular challenges around the enforcement issues. The PSNI focus there, as in other places, is on early intervention and the 4E's approach: engagement, explaining, encouraging and, where necessary and appropriate, enforcement. It is important that if members make sweeping statements about the PSNI, that they are informed comments. He said there had been limited enforcement, when in fact over 900 fixed penalty notices have been issued in the last 3 months. In addition to arrest and other interventions, such as the issuing of COVID tickets, the police report all actions taken against students to the universities to consider disciplinary investigations and sanctions. PSNI has referred over 1,100 students to their respective universities. Following the Halloween period, which was relatively uneventful, the Holy Lands has experienced a rising number of calls for service regarding noisy parties. There was extensive media coverage of disorderly student gatherings in the streets on the nights of the 23rd and 24th of November. I think we would all agree that those scenes were disgraceful, and that it is unacceptable that those who live in that neighbourhood, whether they be full-time residents or students, should not have to tolerate this kind of disruption. The PSNI re-evaluated the operational response and put in place a specific operation from 5 p.m. to 3 in the morning, and that will remain in place until such times as they no longer require it to be so. The primary focus of the police operation is high visibility reassurance on foot and in vehicles. Active engagement with local points of contact within universities, Belfast City Council and local community is crucial on an ongoing daily basis. PSNI and South Belfast have been extremely proactive this year, and since the 13th of September have issued 684 COVID-1 penalty notices, 214 prohibition notices, COVID number 2, COVID number 4, 224 penalty notices, that's post the 12th of November, 62 community resolution notices and conducted 3 arrests. On the wider point with respect to compliance and enforcement, the Executive set up the Strategic Enforcement Group, now known as the Strategic Compliance Group, to assist our response to compliance and enforcement, given that it is a cross-cutting matter. The group is led by the junior ministers, as I've said, and my department is represented alongside a number of other departments and statutory agencies, all of whom are working hard in the collective effort of encouraging compliance. Enforcement activities should be proportionate and seen as legitimate. And I think that that is important. PSNI is continuing to work with retailers, transport providers, hospitality trade and others to support compliance with the government regulations by engaging, explaining, encouraging and people to make the right choices. The police will only enforce where necessary, and this position is endorsed by the Northern Ireland Executive and the Northern Ireland Policing Board and is in line with the National Police Guidance from the National Police Chiefs Council. Mr Sheehan raised the issue of how we can support and encourage people to comply, and Mr McGrath made similar comments. People are weary and exhausted, Mr Principal Deputy Speaker. The COVID restrictions mark a huge limitation on our way of life, albeit a necessary one. We are social creatures, and in times of stress our natural instinct is to huddle for protection. It is therefore unnatural and requires a high degree of restraint, concentration and awareness for people to maintain their social distancing at times when they are anxious and under stress. Despite all of this, the evidence that we have seen as an executive is that most people want to comply, and so making it easy for them to do so is hugely important, and that includes those who may struggle with cost. The Department for Communities provided approximately £60,000 through USAL to make and distribute face coverings to those who are vulnerable. In addition, Mr Principal Deputy Speaker, prisoners in McGilligan, who were also involved in producing scrubs for the health service, turned their sewing skills to good use in order to provide face masks, and it came as part of a community collaboration where local churches donated fabric and the prisoners stitched face masks and passed them on to schools, to children's wards in the hospital, and to a number of other community organisations. And I think it is an encouraging thought that those who are in our prisons are a part of the effort to try to tackle coronavirus and to support the local community. In terms of face coverings, a number of members, including Pat Sheehan, Pam Cameron, William Humphrey and others, raised the issue around the debate on face coverings. The Health Protection Regulations No. 2 make the wearing of face coverings mandatory in a number of indoor spaces, such as shops, public areas and public transport. The wearing of a face covering has never been presented as a panacea to prevent or reduce the spread of the virus in our towns and cities. It should be noted by all that the Executive has been advising since early in the pandemic that people should wear face coverings, though it was not made mandatory until later. The wearing of a face covering is one of the measures that we can all take to help curb the spread of the virus and play our part in bringing levels of infection down. Other measures are maintaining social distancing, washing our hands, avoiding touching our faces, and all of the other things that we have discussed at length. One of the reasons that we didn't move straight to regulations is that there was some concern expressed by the WHO and others that whilst the introduction of face coverings does reduce transmission, the accompanying relaxation in people's other behaviours, such as social distancing and contact with others, could offset some of those benefits, particularly in cultures where the wearing of face coverings is not culturally normal, and therefore people would struggle to remember to wear them, but also when they're wearing them might feel a false sense of security. So there are issues with face coverings, and that had to be weighed by the Executive, and what we tried to do was implement it at the correct time. There is no scientific evidence that wearing a face covering can make a healthy person unwell. The World Health Organization has issued advice on face covering and addressed some of the myths around prolonged use of medical masks. The prolonged use of medical masks can be uncomfortable. However, it does not lead to carbon dioxide intoxication or oxygen deficiency. While wearing a medical mask, you should make sure that it fits properly and is tight enough to allow you to breathe normally. WHO also advises that we should not reuse disposable masks and change them as soon as they get damp. Mr Speaker, there is no, as I say, scientific evidence that it will make a healthy person unwell. However, it is recognised that for some people with underlying respiratory conditions or sensory issues, wearing a face covering can be problematic or extremely distressing. And for that reason, the restrictions exempt such individuals from having to do so. By following this advice, we can help protect ourselves, our families and others from serious illnesses and protect our health service, our economy, and help further prolonged and more stringent restrictions. I want to thank also Paula Bradshaw for her remarks reflecting that the crucial issue in all of this is how we individually act to stop transmission. A number of members, including Paula, Pam Cameron and others, raised this issue of personal responsibility. Mr Speaker, with the rate of transmission that we are currently seeing, everyone needs to play their part to bring the levels of infection down and to protect both lives and livelihoods and indeed our liberties. It is a matter of both personal and collective responsibility. We have a responsibility to help curb the spread of the virus by maintaining social distancing, maintaining good hand and respiratory hygiene, wearing face coverings, self-isolating immediately if we experience any symptoms, including a new persistent cough, a fever, a loss or change of smell or taste, seeking a test if we experience those symptoms, downloading the Stop COVID NI app and complying with the restrictions in place. If we follow that advice, it can make a difference, and it will make a difference. People do need to adhere to the restrictions, but where they do not, enforcement has a role to play. While there has been, understandably, given the context, a natural focus on enforcement, we should also remember that high levels of enforcement are actually indicative of a failure to bring people with us, to convince them that these measures are necessary and encourage them to be careful even when they are out of sight of enforcement activity. It is therefore really important that we show leadership and encourage and support others to comply. And I think Orlea Smith made that point very strongly. And whilst I am absolutely sympathetic on the issue of the cost of the penalties and fines, these fines are entirely avoidable if people follow the regulations. So it is an easy thing to avoid being fined. Pam Cameron further asked for clarity on what details would be required to be taken by hospitality for contact tracing. Regulation 4C, number 3, state that the name and phone number of one member per household, plus the date of visit, time of arrival and number of members per household have to be recorded and held. And my understanding is that is for a period of 21 days in order to allow contact tracing. Mr Speaker, a number of members, including Pat Sheehan and Robbie Butler, made reference to the relaxations which are to be permitted over the Christmas period and the need for people to be responsible and considered. I will not test your patience by going down the road of discussing those relaxations, as they don't form part of these current regulations. Suffice to say that we are all aware that every contact, every personal interaction, every crowded place, be it a shop or a living room or a bar or a restaurant, every unventilated space, every time we are in those places, we increase the risk of transmission. The relaxations that have been announced by the Executive are permissive. No one has to do any of this. You can maintain your current stringent social distancing, your current isolation, and all of the other measures for as long as you wish. You are not required to bubble with family, and some of you may be relieved to hear that. So you can decide instead, as many of us who are less sociable will do, to close your door on Christmas Eve and not open it again until New Year. And for your health, that may be good, but for your interactions with your family and friends, not so much. Well, surely.
Would the Minister, just in light of that, would the Minister agree with me that notwithstanding the debate we have had here and the useful debate around evidence and process and the need to carry out these emergency measures in a very hasty way in some regards, that there are some pieces of evidence that have to be considered and are crucial and are beyond dispute, one of which is that our hospitals today are at 102% capacity. There are more people in our hospitals today than there are beds for. There are also, I think, only something like a very small number of ICU beds left available, and we have had 1,073 deaths, and that people need to bear these things in mind when they're making decisions over the time ahead.
Absolutely concur with what the Chairman of the Health Committee has said, and it is very wise advice. These are permissive regulations. No one has to get together, and there are risks attendant in doing so. And I would ask people to think carefully and weigh up for themselves whether the benefits of getting together with family, friends and socialising is worth the risk that might bring to those people with whom they have contact. Many may make the judgment, and some already have, that they would rather postpone their celebrations with family until we are at a position where the vaccine has created a safer environment in which to do that. But it is a matter, I think, that we have to leave to personal. We talked about liberty. It's a matter that we need to leave to personal judgment. I think it would be cruel and unwarranted for us to try to prevent people from being able to meet with family over that period, particularly those who may have, for good reason, a prospect of this being the last Christmas they might spend with some of their family members. And so I think we have to be sensitive to that. So I would simply ask that people do, as the Chairman of the Health Committee has suggested, and as I have said, to approach the holiday season with caution. The advice has and will not change when it comes to hand and respiratory hygiene, wearing masks, ventilating spaces, keeping your distance. Don't drop your guard because it's Christmas, because COVID will not change because it's Christmas. It will not be taking time off. Mr Speaker, the other issue that was raised by Jerry Carroll in his contribution was with respect to the cost to councils, and I want just to finally inform him that the Department for Communities have committed additional funding to all councils to assist with combating COVID in excess of £85 million so far. All councils have confirmed that they do and can deliver the requirements of these regulations in terms of the resources that they have. So, Mr Speaker, in conclusion, today was a useful and a constructive debate, and it is part of the opportunity for scrutiny which members can undertake. We are all learning how to respond to what is a novel virus, and your scrutiny contributes to how we take forward future regulations and restrictions. So I would want to reassure members this is not a waste of your time. You are not simply talking to things that have already come and gone, but you are actually engaging with us in terms of how you want us to take things forward in the future. However, today is also a momentous day regarding the vaccine, and that is something that I think will be universally welcomed. I want to thank the scientists who developed the vaccine, those individuals who stepped forward in record numbers to assist with clinical trials, and also to the preparatory work done by the Department of Health to roll out mass vaccination. When the Health Minister is here, he cannot blow his own trumpet because that would be seen to be inappropriate, but I shall blow the Health Minister's trumpet for him on this occasion. I have seen with my own eyes the work that has been done in my own doctor's surgery in terms of the preparatory work around this, in terms of how they rolled out the flu vaccine. Many people talked about people running out of the flu vaccine, but of course the truth is that the flu vaccine was rolled out so quickly and so effectively that actually we exceeded the capacity in terms of vaccinations. Many surgeries hired halls, community halls, church halls and other venues in order that they could test and trial mass rollout of vaccines. We know how to do this quickly, effectively, efficiently. We know how to get this out to the public. What we now need to do is to build the confidence in the public that this vaccine will provide us with part of the solution to returning to normality. And I think we have an opportunity here to go into the Christmas season and beyond with optimism, perhaps for the first time since this descended on our shores earlier this year. It is the light at the end of the tunnel, but we are not there yet. And so in the meantime, I would really plead with people, bear in mind what the Chairman of the Health Committee has said about our health service. Think about the people who have already passed away. Be responsible for your own actions and take care of yourself, your family, your friends and your community. And if we work together, we will get through this.
Thank you, Minister. The question is that the Health Protection Coronavirus Restrictions No. 2, Amendment No. 13, Regulations NI 2020 be approved. As many as are of that opinion say aye. Contrary, if any, no. I think the ayes have it. The ayes have it. We now move on to the second motion on the Health Protection Coronavirus Regulations, which has already been debated. I will ask the Clerk to please read the motion.
That the Health Protection Coronavirus Wearing of Face Coverings Amendment No. 4 Regulations Northern Ireland 2020 be approved.
Thank you. I call Mrs Naomi Long to move the motion.
Move.
The question is that the Health Protection Coronavirus Wearing of Face Coverings Amendment No. 4 Regulations NI 2020 be approved. All those in favour say aye. Contrary, if any, no. All those in favour say aye. Contrary, if any, no. Mr Carroll, I am saying that Jerry Carroll said no. That's now in Hansard. Okay, so all those in favour say aye. Contrary, if any, no. I think the ayes have it. The ayes have it. We now move on to the third motion on the Health Protection Coronavirus Regulations, which has already been debated, and I ask the Clerk to please read the motion.
That the Health Protection Coronavirus Restrictions No. 2, Amendment No. 14, Regulations Northern Ireland 2020 be approved.
Thank you. I call Mrs Naomi Long to move the motion.
Beg to move.
Thank you. The question is that the Health Protection Coronavirus Restrictions No. 2, Amendment No. 14, Regulations NI 2020 be approved. As many as are of that opinion say aye. Contrary, if any, no. I think the ayes have it. The ayes have it. We now move on to the fourth motion on the health protection coronavirus regulations, which has already been debated. I ask the clerk to please read the motion.
That the health protection coronavirus restrictions number 2, amendment number 15, regulations Northern Ireland 2020 be approved.
Thank you. I call the Minister to move.
Beg to move.
Thank you. The question is that the health protection coronavirus restrictions number 2, amendment number 15, regulations NI 2020 be approved. As many as are of that opinion say aye. Aye. Contrary, if any, no. I think the ayes have it. The ayes have it. We now move on to the fifth motion on the health protection coronavirus regulations, which has already been debated in this House. I ask the clerk to read the motion.
That the health protection coronavirus restrictions number 2, amendment number 16, regulations Northern Ireland 2020 be approved.
Thank you. I call the Minister to move the motion.
Beg to move.
Thank you. The question is that the health protection coronavirus restrictions number 2, amendment number 16, regulations NI 2020 be approved. All those in favour say aye. Aye. Contrary, if any, no. I think the ayes have it. The ayes have it. Before we move on to the Economy Committee business, I could just ask members just to take their ease and don't forget when you're leaving to clean your surface. Thank you.